short. Well, one day I was headed to the office, and Cinder was supposed to be at school. And as I'm driving down to get to the freeway so I can head up to the office, a car pulls out in front of me, runs a stop sign, and runs me off the road, and then just turns and goes up the street. Now, I was not very happy. I was a little upset because I almost wrecked. And so I thought, like any responsible person would, I'll just catch up to them and impart my great wisdom to them. That's what I was thinking. And as I got a little bit closer to this vehicle, I recognized the vehicle. It was mine. And I recognized the driver of the vehicle. It was Cinder, my daughter, whom was supposed to be in school, but instead had a whole carload of her classmates and was not in school. So I called her on the phone. And she answered the phone and she said, "Hello," very quietly. And I said, "How are you?" She goes, I'm fine, Dad, but I'm in class." And I said, "Oh, I see." And she goes, "And I only took the call because it was you, Dad. I need to go. The teacher is coming." And I said, "They are, huh?" And she said, "Yes." And I said, "Well, before I let you go, I need you to do me a quick favor." "Yes, Dad, anything." "Look in your rearview mirror." And there I was, and all she said was, "Shoot." She was caught. Well, unlike my daughter, chemistry doesn't lie. Oils are either pure or they aren't. Oils are either potent or they aren't. And so we go through this whole analytical process, not every once in a while, every single time we test an essential oil, because it's one of the only ways, is the only way that we can prove out quality to the context that we need. Now, here's a good example of what I'm referring to. Now, we don't want to disparage other people in doTERRA, so I won't tell you who this company is, but this is a comparison of doTERRA's lavender versus their lavender. This is a good example of diluting the essential oils. And you can see that if we look at the chemistry, the complexity of the chemistry that exists with the doTERRA essential oil, by comparison to what we see with the other one, this is a classic example where somebody said, maybe it was a good oil to start with, but if I extend it, if I add other things to it, I can sell much more. This is a common practice with essential oils, and one of the things that we were trying desperately to disrupt. This is one of my favorite examples. Now, if you look at the middle oil, this is actually doTERRA's Melissa. Now, I love Melissa oil as a whole. We'll talk about that sometime in the future, but if we look at the chemistry that's associated with that, it has a very specific chemistry profile, including germicide D and citronol. Sorry, I couldn't read it. And citronol. Citronol and germicide D are somewhat unique to Melissa essential oil. On the top is another company's Melissa oil. So we did a test. We looked at that oil. And you can see that the chemistry between what they have is different than the chemistry between what we have. We have geraniol, that's the same. And nerol, that's the same. Beta-caryophyllene, that's the same. But they don't have any of the germicide D and they don't have any of the citronellol. They don't have any of that in there. It's not present in their essential oil. Interesting though, and this is a common practice, lemongrass has the same chemistry profile to a large extent that Melissa does. It's more readily available, doesn't cost nearly as much, and so if we just take lemongrass and we add a little bit of beta-caryophyllene, it will look a lot like Melissa. And much of the Melissa that people are buying is actually just lemongrass. We feel like that is deceitful and unacceptable. You and I deserve better than that. This was the impetus for why myself and Dave Sterling and Emily and Greg and all of our other partners who have joined with us have been so resolute in this particular item. The oils are good enough. We don't need to pretend like there's something that they're not. We don't need to try to change them and to try to alter them. because they're perfect in the form that we can receive them if we commit ourselves to following a standard of quality. That's what CPTG is. It's allowing us to follow that. And why do we care about it? Because when the chemistry is inconsistent, when there's inconsistencies in the chemistry of an essential oil, there's inconsistencies in the benefits of essential oils. Now I recognize I'm spending a lot of our time talking about, that can't be right. I only have an hour left. That timing can't be correct, so I'm going to ignore that and just speak till my watch tells me we're done. Or either that or 3 hours has just flown right by, hasn't it?
2 hours, 40 minutes.
I know that I've been, thanks Dave, I know that I've been spending a lot of time on this, but it's because I want you to have confidence. I don't want you to feel challenged when somebody says, but my oils are good too. Maybe they are, but they're not the same as doTERRA's. Now this has also been an opportunity of discovery, and it has forced us into developing new sciences and new understanding of how we might look at the quality of an essential oil. And one of the things that's interesting about chemistry is biochemical pairing. That when we see one chemical component, we see an equivalent partner associated with that. It's easy to tell if an essential oil has been changed or adulterated or diluted in some fashion when we look at those ratios and they're either non-existent or the ratio itself is diminished. It doesn't equalize in the way that it should. So we developed a process known as arc plotting. I don't really like the name, but it describes it perfectly, where we're able to identify and qualify, has an oil been adulterated? Are the ranges and the ratios of that chemistry in an appropriate amount? And what is the overall composition of the essential oil itself? Now, the other thing that's valuable here is that each number pair, each biochemical pair, is its own representation. It has its own unique fingerprint, its own unique way of being able to look at that. And so if we look at, for example, oregano essential oil, and we plot out our oregano, which we know is 100% pure, by looking at those biochemical pairs, and you can see the biochemical pairs. For example, in set number 1, we have carvacrol and its ratio to gamma-terpenine. We look at all of that biochemistry, and it gives us a very specific numerical plot that we can look at, a fingerprint, if you will, of all of the biochemistry that exists with the essential oil. Look what happens when we start overlaying other essential oils that are commonly in the marketplace. This oil was out of range, meaning that the biochemical pairs were not matched. They were distorted in their ratios, which does not happen in nature. That's the big advantage. In nature, the ratios are not distorted. And so when we see distortion, we know that we have adulteration or change within the essential oils. Now, there's been other ways for us to validate the essential oils. I don't want you to think, even though this is true, we have several labs that exist at doTERRA. And if you ever have an opportunity to come to the United States and to come to our corporate headquarters, please let us know. We'll take you on a tour. We'll let you see the labs. We'll let you talk to some of our chemists. They love doing that. They love sharing with people what they know. And so we'd love to do that for you, but I don't want you to get the impression that that is our only testing model. We work with a number of outside labs as well. So we do primary, secondary, and tertiary validation. When we have multiple subsets of the same testing, we begin to have greater understanding of the purity of the oils that we have. And so APRC is one of our partners, and you'll begin to hear more about them as we go forward and all of the testing and the analytics that they do in addition to what we do. So we have this great opportunity to have complete exposure. We don't have anything to hide with the essential oils. We're proud of what the oils are. We believe that they are in the best context that they possibly can be. We believe that they are 100% pure. We believe that doTERRA's essential oils are uniquely different. Now, the other piece that fits into that is some of what Dave Sterling talked about this morning. I like that Dave Sterling talked about how now 96% of our essential oils are 100% exclusive to doTERRA. That is a worldwide effort. That's not a singular event. That's not a singular vendor. We don't work with vendors. We work with farmers and growers. We build distilleries all over the world. Some of the uniqueness of doTERRA oils comes from these partnerships that we form and exclusivity. So yes, while there are other frankincense essential oils that are in the marketplace, no one else in the world has what you have, because we have 100% exclusivity with it. Now, the other part of that, Dave mentioned this morning talking about Haiti. And he talked about vetiver as an essential oil. I don't have a slide to demonstrate this, but I'll use it as a subset or in addition to what Dave talked about this morning. One of the things that we did in Haiti was Dave talked with you about some of our distillation practice modeling. He talked about that in the context of how we liberate the essential oils. We build these distilleries all over the world. We've got these big round distillery units where we pack, he said, sometimes in excess of 2,000 pounds of plant material. That's an amazing process to watch. One of the things that we discovered with vetiver essential oil is that if we use a square box instead of a round cylinder when we liberate the essential oil, the chemistry changes dramatically. And we get a great increase in a sesquiterpenoid known as veterone. It's a sesquiterpene ketone. And we get a lot of veterones in there that's not normally present in the essential oil. It's one of the reasons why doTERRA's vetiver is different than any other vetiver in the entire world. It's not just about forming relationships, it's about forming a commonality between us, where we look at harvesting practice and methodology. For example, our cardamom essential oil that comes out of Guatemala. There is a very unique and specific harvesting and drying practice before we distill and extract those seeds for their essential oil that takes place. And then even in the extraction methodology itself. This is an interesting essential oil because 90+% of all the oil that's found in those seeds will be liberated within the first 10 minutes of distillation. You literally can fill, turn it on, go down to the bottom, and you're already liberating essential oil. What's interesting though is that if you distill for another 5 to 6 hours, you get the remainder of the chemistry. Most people like to distill for 10 or 15 minutes. We don't. Our cardamom essential oil, because of our harvesting methodology, because of how we dry the seeds, because of how we distill the essential oil, created a cardamom essential oil that's really not been seen before. It has chemical components which are volatile aromatics that you normally don't see. And why don't you see it? Because people don't make the same commitment that we do. This is why co-impact sourcing is so important. This is why it has the effect in that doTERRA essential oils are different and they are exclusive. It's the summation of all of those different things together and how that works. Now, we're on a new cusp. I said that this quality standard was an opportunity for discovery. Over the last 10 years, we have been consistent in discovery. We started the company in early 2008. And in 2008, we began doing biochemical studies that allowed us to understand the antimicrobial benefits of essential oils. We knew that they were anti-infectious. That then was followed up by us being able to look at, never been done before, the entire human genome. We took every known protein and we tested more than 30 of our essential oils. And we looked at the entire human genome. What proteins are upregulated? What proteins are downregulated? Never been done before, but began giving us some insights as to how essential oils are working, why they're so unique, and why all of the chemistry matters. To date, actual clinical trials with essential oils, there's been very few. There's less than 300 that have ever happened in the entire history of essential oils where we do human clinical trials. But over the last year, doTERRA has been responsible for 4 of them. In addition, we've completed and studied and done more than 22 peer-reviewed studies on essential oils. We're moving the reference of science forward in the essential oils because we do want to improve understanding. We do want to know more about them without exception. Now, recently, at our convention that we had in Salt Lake, we talked about receptor docking. This is an opportunity for us to see for the first time interaction with specific proteins, with essential oils. And now that's progressed to, we understand for the first time, biochemical pathway. Meaning, remember what CPTG is. CPTG is this opportunity to not just look at the chemistry, it's an opportunity to understand the effects of that chemistry within the body. We're certifying that the oils are pure, but we're also certifying that the oils are therapeutic. Now, everything that happens in your body happens through chemistry and its interaction with cells, which, if you think back to your high school biology days, you know, makes up body systems and body function. And so it's important for us to understand how essential oils are directed through the cells. This is a good example. We know that essential oils have specific targets. For example, we know that thyme essential oil has this warming effect because of its interaction with TRPM receptors. GABA A receptors are responsible for the relaxation that we see with thyme oil. TRPV receptors, thyme essential oil interacts there, and that's what makes it soothing and calming. TRPA is what makes it relaxing. We know and are beginning to understand the specifics of essential oils, and that's led us to this new area of discovery where we now qualify essential oils differently in terms of quality. We do all the things that we've been doing, but now in addition to that, we can look to see, is the oil really therapeutic? Those of you who are at convention, and we don't have time to go into it all today, really got to have some greater understanding as it was defined by this standard CPTG, looking at the analytical chemistry. Is the oil pure? Is it what we believe it to be? Is the chemistry complete? But then also looking at the therapeutic response, the benefits that we receive. That's biological chemistry. And so now for the first time in the history of essential oils, we look not just at analytical chemistry, but we look at biological chemistry. That's never been done before. doTERRA is the only company that's even beginning to think this way. The value of that is clear. This is a good example. Later on, I'm going to talk with you a little bit about copaiba essential oil. Fast has become one of my favorite essential oils of all time. And copaiba is important because of its interaction with what's called the JAK-STAT pathway, reduces inflammation. We can look at the whole of the oil, not just a single component, and we know the pathway now that it follows in the body. Meaning that now we can look at an oil and say, this is exactly what this oil will do for you. That's never been done before. The real value of this, you know we did it. We compared other essential oils that are in the market, including copaiba. And one of the things that we found was not only do they not interact in the same pathways, much of the time the responses that they solicit are negative responses, unwanted outcomes. This is the exact antithesis, the anti-antithesis, the antithesis of what we're trying to accomplish with the essential oils. We can't just say that an oil is pure, it has to be pure. We can't just say that an oil is therapeutic, it has to be therapeutic. And we do that better than anyone else. My friends, have confidence. When you look at your bottle and you see that little insignia that says CPTG. Now, we've spent the first hour of our time just talking about quality. But when you see that, I want you to think to yourself, the best in the world. There is no other option for me. This is what I'm going to be willing to do. Will you partner with me in that? Will you have confidence in that? Now, I'm going to ask Dave Sterling to stand up. This is unusual, but I'm going to ask him to stand up. Would you mind standing up, Dave? Yeah, I don't need anything. I just wanted to see if you'd stand up if I told you to. No, please keep standing up, Dave. I just wanted to see if you'd still do it. No, I'm joking. On behalf of myself, and I'm sure that Dave will agree with me in this, on behalf of myself and Dave Sterling and all of my other partners, you have our unwavering commitment that we will not compromise on quality. Would you agree with me on that, Dave? We just won't do it. So have faith, have trust, and have confidence. Thank you, Dave. Okay, are you ready to talk about some oils? All right, let's move to some essential oils. Now, there are some things that we do know about essential oils, in addition to what I've told you. And some of the things that we know is, we know first and foremost that oils, in the context we've been talking about, we know that they're biologically active. You and I have an expectation with them. Sometimes we use oils, peppermint case in point, thank you again. Sometimes the activity that we see is very quick. It's a fast response. Sometimes we may not be able to sense, know, or even determine the response because it's more in an internalized atmosphere. It is working through biochemistry. It is causing change in response. But we do know through science and through our own experience, essential oils work. They're biologically active. We also know that essential oils, a long time we believed, and we didn't really, when I first got involved with essential oils, we didn't know how they were biologically active. And so there was a lot of mystery that revolved around the essential oils. That's beginning to unravel for some of the reasons that I just shared with you, this deeper understanding of biochemical responses within the body. And when we look at biological chemistry, we've now learned and understand that essential oils aren't just active at the surface of the cell, but they have very specific cell targets. Now, sometimes those cell targets are responded to, or the response is elicited by some type of an activity on the surface of the cell. But we also know that there is chemistry that is directed to the interior of the cell. This is why the framework of essential oils, the fact that Dave used this term earlier this morning, that oils are lipophilic, because of their small molecular size, this really means that the essential oils are ubiquitous. It means that there are no barriers within the body. The more volatile an essential oil is, the smaller its molecular size is, the more ubiquitous it becomes. The more quickly it's metabolized, the more quickly we receive those benefits. The cell membrane itself is also not a barrier to the essential oils. And while all essential oils and all of its chemistry does not work from within the cell, there's ample evidence to suggest that some do. And that's it for me. Thank you very much. There are specific, no, I'm joking, no, unless you want me to leave. Some of you were happy about that. Those of you who clapped, would you please stand up and just leave the room? That would be perfectly fine at this moment. There are specific cell targets. We know that there's interaction with the mitochondria, which is the powerhouse of the cell, right? This is the metabolic powerhouse. We know that there's interaction with the DNA of the cell. What's upregulated and what's changed. We know that a part of normal metabolism in the body is damage to the DNA. So that's a significant understanding of the essential oils. And lastly, we know that the essential oils are selective. Now, nobody has ever been to identify adequately why the oils are selective, but there's ample amounts of evidence that says that they are, research that's been done. So let me tell you what I mean by being selective. Some essential oils, in the presence of a damaged cell, can stimulate a process known as apoptosis. I can have the body eliminate that cell. It's a natural process, but I can stimulate it. This cell is damaged. It can't be repaired. I suspect that might happen through the proteins at the surface of the cell. That's part of the reason why we looked at the entire human genome. We were trying to understand more of what that modeling was. It's interesting, though, that in the presence of a healthy cell, so frankincense, clove, lemongrass, lavender fits into that same category. Sandalwood has been studied this way as well. In the presence of a normal, healthy cell, they stimulate protection. So how is it that an essential oil can, on the one hand, when a cell is damaged, either be corrective or stimulate apoptosis? And when a cell is not damaged, that exact same essential oil can act as a protectant for that cell. It's a mystery that we have not been able to solve. And yet there are dozens of peer-reviewed papers that say, yes, that happens. And that research is emerging more and more as time goes on. So let's focus some of what we now know about essential oils. And let's talk about a challenge that every single one of us are going to face. And I've tried to build a framework today around things that, regardless of our circumstance, the doctors in the room would agree with me. Every patient that comes in to see you fits into some categories universally. One is we either have a challenged immune response or we're experiencing something that supersedes our immune capability. And so learning how we can fortify our immune system, learning how we can protect ourselves is an important part of what you can do with the essential oils on a regular basis. So let's learn a little bit about how we can keep our immune system strong. Now let me first explain to you some of what the body's immune response will be, because I oftentimes hear people misspeak about the essential oils. While there are some essential oils that are able to elicit a more profound immune response, your body's own immune response, those are very, very few. And by and large, essential oils don't work by enhancing your own immune response. Essential oils can work independent of your body's immunity. So typically what happens is you're exposed to some type of an antigen, some type of a bug, and it creates an initial or a primary immune response, to make it very simple. Your body also has a secondary response where it forms an antibody should it ever be exposed again. And if you're ever exposed again, now we have antibodies that have already identified what this is, and we generally don't get sick from the same thing over and over again. A good example of that is look at how the flu migrates. From year to year, we have very different strains that we tend to see. And that becomes a challenge for us. Essential oils work by not stimulating our immune response to be stronger, to be more profound. The essential oils themselves, we know, all by themselves, can be antimicrobial. I don't need your immune system to destroy a bacteria. Now, there's different types of exposures that we have. There's bacteria, there's viral infections. Dave spoke a little bit to that this morning. There's fungal infections, there's parasitic infection, protozoic type infections. Your body has a capability of dealing with all of those, but so do essential oils. So I want you to begin to think of essential oils as a secondary opportunity for you, that regardless of my immune capability, the essential oils can help to fill in the gap. Whether I'm compromised or not, the essential oils can still offer some benefit for me. So let's look at what a few of those oils would be. Now, there's lots of ways to categorize essential oils, and going forward, we're going to learn a lot about categorizing essential oils. Not just throughout the rest of today, but as I return through next year. I did tell you I'm planning on spending lots of time with you here. I've got areas of focus where I plan to be throughout the world, and Brazil is one of them this next year. So I'll be here as often as I possibly can. Now there's 80 other countries I also have to focus on. No, we've narrowed that down to 3 or 4 very specific areas for me to focus on next year. And I'm excited that Brazil is one of them. So we're going to have lots of opportunity to talk about how we categorize essential oils. We can categorize them by aroma. We can categorize them by outcomes, what they do for us. We can categorize them by chemistry. We can categorize them by the types of plants that they come from. For example, all flower oils. And so in this case, I'm going to categorize these oils by the chemistry that they possess. And the chemistry that we look at to be anti-infectious fits into 3 really neat categories. One is phenolic compounds. And phenolic compounds work by just destroying the membrane. For example, oregano and the amount of carvacrol it has, that's a phenolic compound. And it literally just punches holes in the membrane. It destroys the organism. And so it's very effective, but it's also very aggressive and very caustic at times. Alcohols are somewhat similar to a phenolic compound, only not as aggressive, and the chemistry is formed just a little bit differently, but they also are strongly antimicrobial. And alcohols have this good overall general support function within the immune system. For example, we see alcohols in oils like lavender and coriander and eucalyptus and rosemary. Those oils have a good general broad sense of activity. And then aldehydes are also strongly antimicrobial, but they work through a completely different function. Alcohols stimulate the body's capability to destroy the organism. They're supportive of that. Phenols destroy the organism by itself. Another way that we can destroy the organism is we can inhibit the communication that happens between one organism and another. And that's primarily what we see with aldehydes, is that how it reacts and responds is through a communication sequence and limiting that communication so we don't have replication. And so things just don't progress. And so it makes sense that we look at all 3 of those categories and some of the oils that exist within them. Now the first oil I'm going to talk about is oregano essential oil. Now I love oregano. When I was first learning about essential oils, I learned a lot of different things about oregano. One of the things that I learned primarily is my mother, who has since passed away, my mother, when I decided to get involved with essential oils, came to me and she made a very sincere plea with me. And her plea was, why would I want to get involved with essential oils? Why would I throw my career away? Why, after I'd worked so hard to be so well respected, would I just abandon all of that to join with a cult, is what she told me. And it was disappointing to me because I'd had an experience outside of my first one. I'd had a secondary experience with essential oils, and I began to realize that they were effective and that essential oils would be effective in the needs that we had as a family. I had a young son who was very ill, and it was essential oils that we turned to. And so it was a natural progression for me to begin looking for oils. As I got involved with oils, some 2 or 3 years after my involvement, my mother came to me as a patient. It's never easy to treat a patient that's a family member. You're just too emotionally attached, if that makes any sense to you at all. But she came to me as a patient, and she wanted to know about essential oils because she had terrible arthritis. She was on several different medications, was in constant pain, and one of the oils I used for her, because of its warming activity, its deep soothing activity, was oregano. I used a combination of oregano and lemongrass over her achy joints, and over a period of 2 months, my mother lost 50 pounds. I got her off of all of her medications, and she went for almost 10 years completely pain-free without having to do any medications at all. Now, as she got later on in life, we had to make some appropriate adjustments. But I like oregano, aside from its ability to support this good, healthy, immune-type activity within the body, and immunity now meaning this really broad spectrum of activity, in this case, irrespective of your body's own immune capability, having those effects, I like it because of its effect on sore and achy joints. Now, it's also really good for fungal type infections, and it's difficult to find things that are effective with fungal infections. Now, oregano is a caustic oil. All oils that have phenols can be caustic, can be irritating to the skin. Those oils are oregano, thyme, clove. Those are the ones that have the phenols, and those are the ones that are the most caustic. Now, I went to a conference in Los Angeles several years ago, and what I noticed was that everyone in the audience had Band-Aids on their face. I thought, that is really weird. I don't know what's happened. So during my presentation, I couldn't help it. I said, why is everyone wearing Band-Aids? And they all said, oregano. And I thought, oregano? And what had happened is someone had told them that oregano, because it's antimicrobial, is a really good skin clarifier. And so everybody was washing their face with oregano. And so they had burns all over their face, all of them. Don't wash your face with oregano. That's the moral of that story. There's other ways that we can use oregano. So oregano is really good as an internal agent, and oregano is really good topically. You can either dilute it or use it on the bottom of your feet. Now, another oil that fits into this let me talk one more thing about oregano. I said that I'd use this for my mother. And one of the reasons why I did is because oregano, aside from being antimicrobial, has some unique chemistry in it. And the chemistry that it has is called beta-caryophyllene, or beta-caryophyllene. You can say it either way. And that is unique because it inhibits inflammation within the body. Inflammation is devastating because inflammation always destroys tissue, no matter what's happening. If it's long-term, it will destroy tissue, and this is what my mother was suffering from arthritis. On the surface of many of your cells, there is receptors. In some cases, we have a receptor that's known as a CB2 receptor, cannabinoid receptor. And CB2 receptors are important because when they're activated, like in the case of beta-caryophyllene, when they're activated, when they're occupied, we stop the cytokine cascade within the body. We stop the production of pro-inflammatory responses. And so I thought that this would be a great oil that I could use for my mother in this capacity, and that proved to be the case. Now, I did dilute it with her. I did break it down a little bit so it wasn't quite as caustic and she can use it routinely. But that's another really good option with oregano essential oil. Now, that's different than clove essential oil. What I like is that thyme has a different outcome, clove has a different outcome, and oregano has a different outcome. Now, I also recognize, let me put this caveat in place, I also recognize that not all of the oils I talk about today do you have here in market. I know that. But I am trying to give you this much broader perspective. And so if you don't have the oil yet, learn the principle. But many of the oils I'll talk about in categories, you do have some or all of them. And I know the products that are coming to you very soon, and some or all of these will be included in those products that will be here very, very soon. So that's why I'm giving you a much broader perspective in some of what we're talking about today. Now, I like clove essential oil. I like clove because one of the unique things about it, even though it's a phenol, the primary phenol that we see is called eugenol. Let me give you another caveat, may I? Don't worry about all the terms I'm throwing out. This is how I have to think of the essential oil. I find myself sitting in hospital boardrooms and talking with scientists, and I can't say, you know, it's that thingy that gives it that numbing effect. I can't say that. And so I tend to speak in these terms that define it very clearly for people. I don't want you for a moment to feel like you have to understand all of that terminology and all of the depth and detail that we may go into to be effective with the essential oils. I use my wife as the great example of this. I asked my wife one time why she used frankincense every day. And my wife said, I don't know, it just makes me feel good. And she asked me why I use it every day. And I went into this long explanation talking about all the cellular effects and how it would fortify and what it would do and some of the pathway that it went into and some of the unique chemistry. And she just looked at me and said, see, makes you feel good. Right? You don't have to know all of those details. But I do have to know them, so forgive me for throwing a lot of them out. So the primary element that we see in clove, which makes it unique, is this phenol called eugenol. Now, eugenol is not new to science and medicine. I would bet Dr. Stoyer would be happy to talk with you about the historical uses of clove in dentistry and some of the practices that he's been involved in as an oral surgeon. It has a well-known constitution as being valuable for oral health. I myself have had my own experiences with that. I went to a dentist several years ago. I promised Dave I wouldn't say it was him, so I won't tell you it was Dr. Stoyer. It wasn't him, actually. But the dentist left a file inside my tooth, did a root canal and left a file. And over the next several years, that eroded away my whole jawline. And so I had to go in for several procedures, including bone grafts and a number of other things. I remember the day I went in for the first procedure, and the surgeon that I worked with said, here's your prescription for antibiotics, and here's a prescription for pain. And I just looked at him. He knew who I was, and he says, and you're not going to take any of those, are you? And I said, I just don't need to. And the oils I went to was clove and frankincense. Clove managed all of my discomfort. Clove also, along with the frankincense, helped the tissues to heal quickly and completely. Clove has this really wonderful numbing effect. So where oregano is warming, the tissues themselves become warmed. With the clove essential oil, they become numb. And so this is a perfect dental application. It's good for oral health in general. So think about clove in that way. Now, I've got listed on here canker sores. You can use it for a canker sore. And if you're brave enough, it would be a great thing to do. Now, Corey Lindley, who some of you know and some of you don't know, when Corey first came to our company, he came to our office one day and he said, well, Doc, I got a canker sore. What do I do? And I said, well, that's easy. You use oregano. Now, thinking that he would know I was joking, I didn't say anything else. And Corey went home that night and got out his oregano and rubbed it all over his canker sore. The good news is that the canker sore went away. The bad news is he didn't talk to me for like a month. He was very upset. Use clove essential oil, but dilute it just a little bit, because remember what I said about these three oils. They can be caustic, meaning you might be able to tolerate it, you might not. One of the ways that we tolerate it is through dilution. And I'll give you some greater explanation about dilution a little bit later in the day, about when we dilute and why we dilute and even how much we dilute in essential oil. So think about clove in that context. Now, that's not the only thing that clove does. Clove, remember, I already identified it as one of these oils that is able to differentiate between healthy and unhealthy. That makes it a little bit unique. If we were to look at antioxidant activity in the body, if we could look at that empirically, we would be able to see the differences that exist, not just between one oil and another, but between antioxidants themselves and essential oils. And clove essential oil is the highest known antioxidant that there is. It by far has greater and stronger activity than anything that we know of. Now, some of the activity that we see with other antioxidants like glutathione might be specialized, but this is a good broad spectrum essential oil in that context. So using clove from time to time is not a bad thing to do. Stimulates the apoptosis, which we already talked about in terms of cell damage. It also supports positive, healthy circulatory outcomes. A lot of times we have very specific challenges, and it can be really supportive of circulatory and cardiovascular issues in general. So think about clove. Now, clove would be used in very much the same way that we would use oregano essential oil, either internally or topically. Now, thyme. Thyme happens to be one of my favorite essential oils that fits into this category. Now, thyme also has a good amount, sorry, that was just my pacemaker. Thyme also has, you guys are not even awake, are you? You didn't. It's okay, I'm just checking. Thyme essential oil fits into this same category of phenolic compounds, but I like it because it's really good for respiratory function. Now, generally when we see respiratory issues, it's more viral than it is bacterial, so that gives you some clues in terms of why I think this is such a unique oil among the other oils that I already shared. Really good for respiratory function. Anti-parasitic. Oftentimes I will use thyme essential oil, 2 or 3 drops, with oregano, 1 or 2 drops in a capsule, and take it in my mouth, and that's been really effective at not only taking care of issues like ulcers, but dealing with parasitic type infections as well. It, as well as the clove, is really good for oral hygiene. It protects the fatty tissues of the body, which I'll talk a little bit more about. And then this last one I have no explanation for. I don't know why it does this. I just know that it does after many years of trial and error with the essential oils. It's really good for snoring. So if your partner is snoring at night, a little bit of thyme on the big toe. I wish I could give you some big scientific explanation about why that works. My suspicion is because the thyme oil is so irritating, they wake up and they don't sleep all night, and so they won't snore, right? See how that works? So you can try it. At least one person is happy about that, so that's great. So you can try it for snoring. But let's talk about this other thing. Let's talk about fatty tissues. Let's talk about how the essential oils work in that context. Now, you have areas within your body that have need for special protection. Some of those areas really involve the central nervous system and the brain itself. Now, in context, the brain is made up of a lot of fatty acids. There's the docosahexaenoic acid, eicosapentaenoic acid, omega-3 fatty acids. That's how you really know them. Omega-3 and omega-6 fatty acids. And there's a delicate ratio that exists. By weight, by volume, your brain has a significant amount of those. And thymol, which is the primary component that we see in thyme essential oil, has been shown that it prevents the degradation of those critical essential fatty acids. So this is a wonderful essential oil to consider using to preserve brain function and brain activity. Now, all of these as a category seems a little bit unique, because if you were to smell clove, if you were to smell thyme, if you were to smell oregano, unless you like pizza a lot, it's kind of hard to get wrapped around. These are oils I want to diffuse. And so really the best methodology here is application that's in a topical or an internal sense. Applying these oils topically, I heard Dave Sterling mention this morning when he was talking about applying essential oils on the bottom of the feet because that's the area in your body where the pores are the largest. That's all true, but there's another reason why we apply them to the bottom of the feet. And it has to deal with systemic benefit, what we're looking for in terms of an outcome. Sometimes we apply oils topically because we want very focal or localized response. Sometimes we apply them topically because we want a broad systemic response. And when we put them on the bottom of the feet, we get this broader systemic response. That is a great way for topical application for any of these oils, unless you have a specific area of concern. If I have a toothache, I'm going to put clove right on the toothache itself. If I have some type of an arthritic joint, I'm going to think about using oregano directly over that joint, if that's how I want to use it. But in a general sense of their microbial activity, their antimicrobial activity, their anti-infectious activity, using these oils on the bottom of the feet is a good context. Now, when I use these oils on the bottom of the feet, I generally do not dilute them, and that will make more sense to you. I'll give reference back to it when I talk about dilution a little bit later on this afternoon, okay? All right, so thyme, I broke it really into these two categories, which we just talked about. So topically, it's good to clear congestion, and it supports respiration, and of course I already talked about snoring. Now, if I were applying oil topically for respiration, thyme essential oil, I would dilute it a little bit. And this is a great oil to combine with an oil like lime, or with lemon, or with bergamot, which also have some good respiratory benefits. It softens the aroma, makes it much more palatable, not quite as aggressive, and this becomes a great oil just to apply topically. If I'm dealing with these anti-parasitic responses, oral hygiene, or protecting the fatty tissues, that's really a good internal model to think of with this essential oil. Now later on I'm going to talk about how much we use. I've not given any specificity to that as of yet, saying that this is a good amount of essential oil to use and why we use this amount. And so let me bring some clarity into that a little bit later on and give you some directives on how we protect ourselves and we don't overwhelm ourselves when we're using the essential oils in this way. Let's talk about cassia and cinnamon. Now, I love cassia and cinnamon. One of the things that you'll begin to learn about essential oils is that much of the information that you see, they're not distinguished. They're not separated. Meaning that a lot of people believe that cassia and cinnamon are exactly the same thing. Well, they aren't. Cinnamon actually comes from the bark of the cinnamon tree, and cassia comes from the leaf of the cassia tree. They're not the same thing, and their chemistry is completely different, even though people use them interchangeably, and they sometimes report the science interchangeably as well. This helps you to understand some of the miscommunication that has existed with essential oils for a long, long period of time, and why all the research and the science that we're applying becomes really critical and very important. Now, they have some common benefits between them, and that's what I have listed here. They are really, really good for bladder function. Now, I'm going to speak very boldly about some things today, and I'm hoping that it'll be helpful. For urinary tract infections, I don't know of anything that's better than cinnamon or cassia. Cinnamon actually happens to be the best between the two of them, even though their chemistry is very similar. That's a great essential oil to add with a citrus oil like lemon and a little bit of lemongrass, maybe a drop of each, put it in a capsule, and UTIs can clear up very, very quickly. One of the things that I'm thinking about in the male environment is a lot of times as you get a little bit older, prostate troubles become a problem, and you may have frequency of urination. A little bit of cinnamon in a capsule, 2 or 3 drops in a capsule, once in the morning, once before you go to bed, will greatly help you be able to reduce that inflammation and control the bladder more appropriately. So some simple little tidbits by what I mean by that. As a mouth rinse, we know that they have great benefit in oral health as well. They're both very helpful. A lot of times we think about essential oils for the cleansing that it has on our internal environment, but there's an external environment as well, so cleaning surfaces and other things. We can also look at it in the context of digestion and metabolism and stimulating an appropriate response within those. There's been a lot of research and a lot of study talking about cinnamon in particular, but cinnamon and cassia in helping the body to have more appropriate glucose responses. How many of you, just out of curiosity, how many of you know somebody with diabetes? Raise your hands up. Wow, almost every single person in the room. I mean, this is becoming a pandemic type illness and disease now. And there's been a lot of significant research saying that this is helpful and beneficial. Again, this is a 1 to 2 drop model just in a capsule. Supports circulation, proper circulation, good for stomach ulcers, and it's a COX-2 inhibitor, meaning it breaks down or interrupts the cascade of pain and inflammation. Now, earlier I talked about how aldehydes, which is what we see in both cinnamon and cassia, high amounts of aldehydes, and one particular aldehyde known as cinnamon aldehyde. Cassia has a significantly higher amount of cinnamon aldehyde than cinnamon does. Cinnamon is somewhere between high 60s and low 70s, and cassia is quite a bit higher than that, even as much as 80+% cinnamon aldehyde. Bacteria, we just had, last weekend, we had a medical conference. back home in the United States, and we had doctors come from several parts of the country, and we spent a full day talking about all the advances in essential oil. I'm going to introduce a new term because it's how I have to refer to it in these environments, essential oil medicine. And one of the things that we had a great deal of discussion about is these infections, and some of you may have experienced this yourself, or you may know somebody who's experienced this, that really supersede all of our body's own capability. Excuse me, forgive me, I'm sorry. That supersede all of our body's own capability. Nothing? Nobody's got anything? It's okay, you'll learn. It's okay, I got some peppermint still. And we looked at how even in those more virulent type infections, part of the way that they progress, I'm talking about infections that are resistant to antibiotics and other therapies that typically are done. As they progress through this process. This biofilm is developed through a process known as quorum sensing. This is a little bit of what Dave was referring to this morning. And as they communicate with one another, they become stronger. And collectively, it's not an individual organism now, it's a colony of organisms that are resisting. And it becomes ever progressive within the body. Cinnamon aldehyde interferes with that communication. And one of the things we looked at this last week in this conference was how the essential oils interfere with that communication strand. It can be as simple for you and I as just learning how to use cinnamon. Now, cinnamon is an essential oil that I actually do like to diffuse. It's also an oil that I like to use topically and that I use internally quite often. So you can use it in any of those methodologies, and what you can do with cinnamon, you can also do with cassia. And if we look at their chemistry, here's some of the differences that you see. That cinnamon aldehyde and cassia is as much as 85%. I think I misspoke on the cinnamon, that it's around 50% typically is what we see. But do you notice the other chemistry? Cinnamon also has phenols within it. And cassia has a very low amounts of phenols. Cassia, even though it has more cinnamon aldehyde, also because of the ester content, even though it's more aggressive, is more soothing to the tissues. Cinnamon is more aggressive, even though its chemistry is somewhat less by comparison, if that makes some sense, because of the type of chemistry that we see. So think about those in a similar context, but choose which one works the very best for you. Now, I created a chart, and I'm not going to spend a lot of time on this chart, but I thought this would be helpful for you, in that I took all of the oils that I generally put into, if we look at spice oils, which is what this is, it's more than just cassia and cinnamon. There's other oils that fit into that category as well. But this is generally how we'll refer to them going forward in the content of our education and as you learn more about the essential oils. What's interesting here is that they're all antibacterial. I like this chart when I developed this because it shows functionality of the essential oils and the individuality of the essential oils. So they're all antibacterial. You can't make a bad choice. Doesn't matter if you choose clove or if you choose thyme or you use oregano or cinnamon, it doesn't make any difference. They're going to be antibacterial. Antiviral, however, we're a little bit more limited. We look at thyme and we look at cinnamon essential oil as being more antiviral than any of the others. Now, how do you know if it's a viral infection versus a bacterial infection? Because if you try one and it doesn't work, then just try the other one. There's going to be no good way for you to tell. There really is almost no good way for us to tell either without doing a lot of tests. So that's why I'm giving you lots of options and dividing this out. You say, well, this one didn't work, so I can try this one now. And that's one of the advantages we have by classifying the essential oils this way. I get lots of choices. Cell protection, clearly that's thyme essential oil. They're all good for pain. They're all good for inflammation. in helping to reduce and control inflammation. And then we have metabolism and respiratory function really just becomes isolated primarily to time. And so when you look at this chart, you see some commonality between them, but you really look at it and think to yourself, thyme is the oil that I really need to learn out of the spice oils, because it has a good broad spectrum of activity, and you would be correct in that thought. So that's why I wanted to show this to you in summary of everything that we just talked about. So I hope that that's helpful. Now let me talk about cilantro, and let me talk about coriander real quick. Now I think you have cilantro already in your market. You'll have coriander at some point as well. But this illustrates a couple of other points for us. One of the things that's interesting is that when we look at essential oils, sometimes essential oils come from the exact same plant, even though the oil itself is very, very different, not the same thing. For example, from the orange tree, we get orange essential oil. We get petitgrain essential oil. Orange comes from the rind of the fruit. Petitgrain comes from the leaves. And then we get neroli, which comes from the blossom. 3 completely different essential oils, completely different chemistry, all coming from the exact same plant. This is what we see with coriander and with cilantro. Now, coriander and cilantro could not be more different, even though they come from the exact same plant. And if you want to be confused in the research, look at coriander and look at cilantro, because everyone just believes it's exactly the same. But it isn't. Like all of the oils, they have their own individuality associated with it. And one of the things that we've seen with cilantro and with coriander is knowing where they come from. Cilantro comes from the leaf, and coriander comes from the nut of the plant or the seed of the plant. Look at the chemistry difference though. Cilantro is all aldehydes, and coriander is nearly all alcohols and monoterpenes. So completely different outcomes associated with them. I want to highlight cilantro for you just briefly, because I think cilantro is an oil that we don't use enough of. And I'll tell you why. We are all exposed to toxicity on a constant basis. Would you agree with me in that? It's a constant thing. We need not only support for our liver, but we need support for the other cleansing organs and systems of the body. And we need an effective way that we can help to eliminate very specific toxicity within that as well. So one of the things that's good about cilantro is it's soothing to a lot of systems within the body. It's really good for digestion. It improves gut motility. It improves digestive capability, for example. So it's a really good essential oil that way. Promotes cell protection. It's good for the skin. I love the aroma. It's one of my favorite essential oils to diffuse, because to me it's uplifting and it's clarifying, and it has a very unique aroma. Not everybody loves it, but I really do. And it reduces stress and tension. The real value I find, however, because a lot of oils do similar things, there's going to be crossover benefits with almost every oil. And so I bring that up to give you a little piece of advice, if I may. You're probably going to go home and at some point you're going to say, now which oil did Dr. Hill say was best for that? Or you're going to go home and say, which oil did Ryan say was best for that? Or whomever it is that might have taught you about the essential oils. I want you to start thinking differently. I want you to think about which oil do you think is best for that. And I want you to draw upon your own experience. And the reason why I say that is because you almost can't make a wrong choice. People will come to me and they'll say, I've got diarrhea, what do I do? And I say, oh, peppermint would be great. And somebody else will come to me and say, I'm constipated, what do I do? Try peppermint, it'll be great. I mean, they have this more than one capability. They work because of their chemistry through several different pathways, which means, in a general sense, they're a little bit adaptogenic to our own needs, to our own bioterrain, to our own enzyme capacity and load, to the concentration of vitamin and minerals that we have, to our body's metabolic capability. And so it can do many things for many different circumstances. And where your friend might not ever use that essential oil, for you that might be the exact one. And so that's why I show a lot of the common benefits. And you've noticed as we've talked about these oils this morning that there's a lot of common benefits between them. That's meant to give you the opportunity to have some personal choice and learn which one works the absolute very best for you. Here's why I like cilantro. I like using this for myself, and I like using it clinically in this way too. That is that they did a study, and they had a group of patients come in who all, to one degree or another, had an extreme amount or a large amount of heavy metal toxicity that had been liberated in their body. Some was for environmental factors. Many of the participants in the study, it was secondary to dental work. They had some mercury fillings removed, and that liberated some toxicity in their system. And what they found is in using cilantro in very small amounts, it was able to act as a chelator, so they were thusly able to remove the heavy metal toxicity. Now, you don't need a lot of cilantro to engage that response within the body, nor do I think it's an everyday thing that you just do routinely. I think it's something you go to periodically for this kind of an outcome. They used 400 milligrams, which really equates to just about 2 or 3 drops is all that they used. And so you can use that very effectively. Another unique usage associated with cilantro. So has fast become one of my favorite processes. Now we're going to go back to something that we talked about a little bit earlier. We talked about how it is that we want to source essential oils for their uniqueness. How we're really concerned not just about the purity of the oil, but we're concerned about the therapeutics of the oil. And so I want to introduce a term to you called chemical polymorphism. And chemical polymorphism I like it when you see that map of all the places that we source essential oils from around the world. That's not a map that demonstrates this is the only place we can get it. It's a map that demonstrates this is where we receive the plant materials from. This is where we form those relationships because of the benefit we see from those, because of the chemistry that develops within those. The environment that a plant resides within largely determines what the chemistry of that plant will be. For example, lavender in Utah, where I live, is not the same as lavender that's grown in other parts of the world. Lavender, which comes from Bulgaria, for example, is beautiful by comparison, and its chemistry is much more robust. That's what chemical polymorphism is. So I want to look at rosemary, because rosemary is another oil. It's really good for respiratory function, but it fits into this category of alcohols. So rosemary, eucalyptus, lavender, coriander, not cilantro, but coriander, all fit into this category of strong alcohol components and elements. We can source this from many different places around the world. We can go to Cuba, we can go to Argentina, we can go to Morocco, we can go to France, you can go to Italy. All of them have great sources of rosemary essential oil. But something interesting happens when you begin to look at the chemistry. And when we look at the chemistry, the process that we go through is, what is it that we're trying to accomplish? This isn't a display that says, oh my goodness, if you get it from here, it's terrible. If you get it from here, it's great. It depends on what you're trying to do. So for example, in Morocco, the 3 primary components we see is a monoterpene, which is pinene, 1,8-cineol, which is an alcohol, in this case eucalyptol, and camphene, which is a monoterpene. And if we get that from Morocco, we have just over 12% that exists of the pinene, almost 47.5% that exists with the 1,8-cineol, and almost 4% that exists with the camphene. Look at what happens if we get rosemary from France. It changes completely, and in France, we don't have a small amount of pinene. It's the dominant feature. We have almost 36% alpha-pinene. And 1,8-cineol, we have hardly any by comparison. And then we have more of the camphene. If you get it from Cuba, the things that we would typically look for almost are non-existent within the oil itself as a component. And so we chose to get our rosemary from Morocco, because we look at different types of chemistry profiles. Now we can look at plant species, and we can look at plant genus, and we can look at plant chemotype. For example, thyme. There's thyme thymol, there's thyme carvacrol, there's thyme eugenol. We look and are very specific to fill the needs we have through the chemistry. And so have confidence in rosemary, because rosemary fits into this category of being anti-infectious for you, and also being a good, strong respiratory essential oil. Rosemary combined with the citrus oil is a really powerful combination. In my home, my daughter, Cinder, that I told you about a little bit earlier, she is and was, not so much anymore, but when she was younger, she was defiant against essential oils. She just liked them in every fiber of her being. She hated essential oils. She came to me one day and she said, "Dad, you stink. You smell like oils. My friends won't come over here because you stink. They walk in here and all they smell is oils, and that's why I don't have any friends." And off she goes. And I'm thinking, wow, that's a horrible thing to say. And so I did what any responsible man would do. I went to my wife and said, "Honey, do I stink?" "Yes, you do." "I don't." That Sunday, my daughter had her good friend named Susie come over to the house. We'd known Susie for a long period of time, and we liked having Susie in our home. It provided a great place for her to be. And Susie came over to our house for Sunday dinner, and I was sitting in my normal spot at the head of the table, and my wife was sitting next to me. And then usually my daughter sits on the other side of me, and my son sits next to my wife. Well, on this day, my daughter being upset at me because I stunk, Susie sat right next to me at the table. And I thought, well, this is a little awkward, but it's okay. And it became more awkward as the meal went on, because Susie, as we were eating, once in a while, she'd look at me and she'd just go, and she'd bat her eyes and be like, "Oh boy, this is really uncomfortable." I leaned over to my wife and I said, "Sweetheart, switch me spots. I think we need to trade." And she said, "No, this is amusing." And Susie she'd just look at me, and she put her elbows on the table and she's looking at me, and I'm just like, oh, this is. And so finally I decided that I would ask her what was happening. And I said, "Susie, are you okay? Do you need anything? Can I do something for you?" And she said, "Well, yes, if you don't mind. I mean, it's kind of awkward." I'm thinking, yes, it sure is. And she goes, "It's just that I come over here all the time." And I said, "Yes." And she goes, "You just smell so great." My daughter was mortified. She hated that response. She couldn't believe her friend would say something like that. Whenever my daughter was ill, we would offer, of course, well, let's use the oils. And she would say, "No, I'm not using the oils. You know they don't work, and I don't want to stink." And so we did what any good parent would do. When she would fall asleep, we would go into her room and we would apply the essential oils on her. And then when she'd wake up the next morning, she would say, "See, I told you I didn't need any oils," because she would be feeling better. Rosemary was one of the oils. Now, we're like most people in our home with kids now and grandkids. There's a lot of respiratory type infections that seem to happen within our home. I don't know if you know this, but little kids are like a festering germ pit all the time. And they bring that into our home. And so this is an oil that, whether it's for our grandkids or ourselves, that we'll use at night when we sleep. Now let me tell you why. Your immune system is more active at night than it is at any other time. And so at night, bolstering that response within your body, giving your body a little bit of extra help, seems to make good sense in those deeper stages of sleep. So diffusing rosemary at night with a citrus oil, or applying rosemary on the chest with a citrus oil, or just a little bit diluted if you like, is a good way to use this essential oil routinely in your family. Now, if you combine all of those together, Oh, here's some of the, I'm sorry, I forgot I put this in there. I broke out some of the other benefits that we see from rosemary. And you'll look at that and you'll see some similar responses, but remember why. Not just for your own usage, but these are oils that fit into a similar category. So they all have similar type responses. They're anti-infectious, they're calming to the tissues, they're good for respiration, they're good for digestive activity. So I've just given you 7 essential oils that you can use any one of those that you would like, and it will create very similar benefits for you. So choose your favorite. That's what I like about looking at the oils in this context. Now, here's another interesting thing about rosemary before I go away from that. This is an interesting study. What you're seeing here on the left-hand side, on your left-hand side, this is abnormal dopaminergic activity. By the way, I need to apologize to you, and I wonder if we can tell all of our support staff who are helping us today, can we tell them thank you? Thank you for all of their hard work. They all are working very diligently and very hard. One of our staff came to me shortly before I began speaking and apologized and said, I'm so sorry, I tried to get all of your slides translated and I just wasn't able to. We didn't have enough time, so I'm fine with that. I just want you to know why you're seeing them now in English, because we weren't able to get all the way through the slides. But that was a little bit fortuitous. So here's what we're going to do for you. So we're going to take my presentation, and I'm going to break it down into smaller components for you. And in the notes, I'll give you the bullet points that highlight all of the attributes of what we're talking about on that slide. They'll translate all of that for you in Portuguese, and you can have all of this. Will that work for you? Is that all right? You can have all of it. So, yeah, except for Justin, you cannot have the English version. I'm sorry, you can only have Portuguese. So when you see our staff, thank them for not doing their job, because it worked out perfectly, right? We really are grateful for them because they do work extremely hard. And I want to personally thank those who are interpreting in our booth today, because that is not an easy thing to do, especially when we get into these longer discussions and more complicated materials. So thank you to our translators as well. We're greatly appreciative for all of your help in helping us to share our message today. All right, so let's go back to what we're looking at here. So we've got abnormal dopaminergic activity. Now, dopamine is really critical, and it's calming and it's relaxing to the body. But when we have abnormal dopamine activity as a neurotransmitter, we see things like Parkinson's and Alzheimer's and ADHD and many other things. What you're looking at in this area that's highlighted with the white and with the orange, that's an area right here. This is an area that's called the caudate putnam, or the caudate nucleus of the brain. On the right-hand side, in this area that's in orange, that signifies dopamine activity, localized within that area. On the right-hand side, this normal activity that you see, again in the same area, the exact same region of the brain, that normal activity is greatly accentuated, as you can see, by the orange and yellow coloring that exists there. That's normal dopamine activity. Now you might look at this and say that this is a normal patient and this is an abnormal patient. They're both the same patient, except for this is the before and this is the after. And what they've looked at now is a very specific compound that we see in rosemary. It's an alcohol, it's called carnosol. And there's been a good amount of research now that has looked and said that carnosol, especially in some of these more difficult cognitive dysfunction activities that we see, some of these processes, carnosol has the ability to restore normal dopamine activity. Now, I don't know why that is, but I've been doing essential oils now for a long, long time. And my experience tells me that those types of things are not just true, those are routine type outcomes with the essential oils. Don't be afraid to try the essential oils. I can't tell you how many people have come to me, and one of the things that I've not enjoyed as a physician, and one of the greatest experiences that I've had as a physician routinely, is as patients come to me after they've tried everything else. You're my last hope. There's nothing left for me to do. If you don't take anything else from what we talk about today, I would like to instill within you two primary thoughts. One is there's always something that can be done. And two, don't wait to use the essential oils. Have great confidence in them. I've seen the oils do things that I consider nothing short of being miraculous, some within my own home. I've had experiences where the oils have been less than miraculous, but nonetheless have been very rewarding. If I may, I'd like to share one with you that's very personal for me. A couple of years ago, as we were preparing for our convention in Salt Lake City, I called Dave Sterling the day before our convention started, and my father and mother were living with us. And my father had become very ill and was passing away. And so obviously I opted to stay with him and to help him through that process. A few weeks after that, my mother was also not doing very well. I had gone to Japan to do some work, and shortly after arriving in Japan, I received a phone call from my wife who said, "You need to come home. It's your mother. She most likely won't be here when you return. You need to come now." That's when I learned that no matter how big of a hurry you are, the airlines never are. I got home as quickly as I could, and I raced home from the airport. And I got there just a few short hours before my mother passed away. We also wanted her to pass away in our home, not in a hospital or some other environment. We wanted to be with her. And my family came together, and although my mother was unconscious and could not speak, we spoke to her. We told her how much we loved her and what we cared about her. Just the week before, my mother had come to me and said, one of the things I enjoy doing is playing guitar and singing. And she said, "How come you never sing Silent Night? That's my favorite song." And I said, "I don't know how to play Silent Night." And so she taught me how to play Silent Night the day before I left for Japan. And so we came together as a family and we sang for her Silent Night. And then my family left me alone with my mother. As I sat there and held her hand, I became very frustrated, almost even angry. I thought, geez, I just lost my father, and now I'm losing my mother, and how is it that I can share essential oils all over the world, and I have all these miraculous experiences, and everyone shares all of the phenomenal things that happens to them in their own experiences, and I cannot help my own mother. And then I remembered something. I can. And so one of her favorite oils was frankincense. So I got my frankincense. And again, although she could not respond, I put it on the bottom of her feet and spoke with her. And then sat with her until she passed away shortly after. Frankincense did not save her life. Frankincense may not have changed her outcome, but I have a strong belief that it made a difference for me, and it made a difference for her. We may not always see the benefits that you're going to receive and experience from the essential oils as you use them for yourself, as you use them for other people. But trying, being willing, that's the doTERRA culture. That's who we are. That's what we do. Many years ago, somebody came to me. I was running a large medical facility, and I was talking with all of the employees and asking them some very specific questions. One of the questions that I asked was, how long have you done essential oils for? I was new to the oils, and I was learning, and I was growing, and I wanted to, thank you, Bill, and I wanted to understand some of their experience. And I asked the question of one employee, and she became very angry at me. And she looked at me very sternly, and she said, Dr. Hill, oils is not what I do. Oils is who I am. Now that might seem extreme to you in some circumstances, but I'm going to ask you to make a commitment that says, oils is not what I do. Oils is who I am. Collectively, being who we are with essential oils will bring about much good, even when we don't believe or don't know that we can. Can you make that commitment with me? Oils is not who we are. Oils is not what we do. Oils is who we are. It's what we do in every context. I can make you a promise that as you do that, regardless of the circumstance, you will feel and do more good than you ever imagined. So thank you for that. Thank you for allowing me to share that. I had no plans to do that, but so a good use for rosemary. Sometimes I wish that, there was a zipper on the top of the head. We could unzip the head, just open it up, dump some oils in, and close it back up. Wouldn't that be convenient? But there's no, who said yes? Come on up here, let's try it. We'll figure that out. There's no way for us to do that, so proximity counts. And so proximity with rosemary primarily is, aside from respiratory and all those other things, if we're looking for this type of a benefit, there's two ways that I like to use rosemary. One, it's not all that fun, but it is effective. If we take just a little bit of rosemary on our thumb and put it up on the roof of our mouth, at the soft palate, if you put your thumb in your mouth, you feel the hard palate just go back a little bit, and you'll feel that soft area. Right above that area, which you cannot access, but right above that area, some very delicate structures of the brain, including the pituitary gland, which stimulates the whole neuroendocrine cascade in the body, neurochemistry. That's a great place to use the oil. The other is, remember, oils are ubiquitous, which means that there really are no primary barriers that we see to the essential oils. And so applying them on the back of the neck, at the base of the skull, if we looked at the anatomy that's there, the circulatory anatomy, we'd realize that although we can't get to it directly, in proximity there is the vertebral artery, which gives rise to the whole posterior half of a structure of circulation known as the circle of Willis. The circle of Willis provides circulation for the brain, and if it's in the posterior half, it's systemic throughout the brain. So that's another good way, or a good application to consider using with rosemary. Now, let's talk about On Guard. So let's look at what we have in On Guard. Are you excited about the On Guard toothpaste? Yes? Are you excited about the On Guard toothpaste? Okay, all right. Let's look at what we have in On Guard. This formula now all of a sudden begins to make some sense to you. Wild orange, which is a monoterpene. Phenols, which is, boy, this is way off, I apologize. Clove is phenols. I don't know why everything is duplicated. Cinnamon, which is aldehydes, and eucalyptus and rosemary, which is alcohols. This gives us a really complex, very detailed formula where we've combined essential oils together that the synergy of the whole is much greater than any one of the single components. And so your all-around go-to essential oil, and an oil that you should consider using on a daily basis, using it with regularity, is going to be On Guard essential oil. So think about that as one of your primary and functional oils to use within that model. Now, Dave mentioned a little bit earlier some of the research that we've done with the On Guard in the past. And I want to highlight two of those. One was with Dr. Wexon Wu, and he was from the University of Oklahoma that Dave talked about. And the other one was with Jennifer Edmonds. She was at a hospital where they were having a lot of difficulties. They contacted me, asked if I would come and visit with them. Almost half of their patients that checked into their hospital received some type of an aggressive infection, these resistive type infections. And so they were very concerned and looking for other modeling that perhaps they could consider that would be helpful in their hospital. This is what Dave was talking about a little bit earlier today with the H1N1 virus. And one of the things that he pointed out was that it was 95% effective in keeping viral components from replicating. Now, we talked about how that was interruptive of the proteins. It's actually interruptive of a process called protein phosphorylation. Excuse me, and Dave is correct. It is about how one protein communicates with another. And so that was a really significant finding. This was really one of the very first research studies that we did in doTERRA. And it was phenomenal that we had that, but that we had such a positive outcome associated with it. This one is, we've missed a slide here, so I'll just summarize it. I'm not sure what happened to it. I received a letter from Jennifer Edmonds, who's the microbiologist who works at this hospital. And she had discovered that On Guard was really effective at reducing and diminishing these types of infections, these more virulent strains, these antibiotic-resistant strains of infections. And she sent me a letter that said it had been said that the On Guard was only inhibitory and that it wasn't actually killing those infections. And she sent me a letter outlining the research that she had done and talked about the performance of the On Guard essential oil at not just inhibiting, but being destructive to those types of infections. That's some of what we've seen now as we've progressed away from these studies and looked very specifically at the On Guard and some of the other oils that we've talked about in their ability to be strongly anti-infectious this way. So I love the On Guard. Daily use model is, may I share with you a daily use model for On Guard? Now you have the On Guard essential oil. In the future, you'll have the On Guard throat lozenges. Someone was kind enough to bring me one here a few minutes ago. You have the On Guard throat lozenges is another thing that you'll have. We have On Guard laundry soap. We have On Guard toothpaste. We have On Guard mouthwash. We have On Guard cleaning for the home. We have On Guard hand soap. We do this because of all the benefits and value that we are seeing from On Guard, and you'll eventually have all of those products here. In the meantime, with the limitation of some of what you have, think about the On Guard itself, the essential oil, and use that as a primary source of cleaning and disinfecting within your home. Every day, find opportunity to use and or diffuse On Guard. It's cleansing to the environment. It's clarifying to the environment. Much of the bacteria, much of the viral components and things that we're exposed to happen through the environment that we're in, through the air that we breathe. So a model of consistent diffusion. Applying On Guard to the bottom of your feet is a good practice methodology to adopt to. I like doing that at night before I go to sleep because that's when my immune system is the most active. That's when I need it to be the most resilient. However, you can do that at any time you want to through the day. One of my favorite uses of On Guard, however, is to put 2 or 3 drops in a capsule and take that by mouth. You can do that on a daily basis. And if you do so, I think what you'll find is that the resiliency that you have, your body's ability to be resistive to infections will greatly improve, and you'll find that you become sick less and less often. So incorporate On Guard into a daily routine. Now, some of my favorite oils, are you still doing okay? Are you with me? You all right? Some of my favorite oils, yes? Okay. Some of my favorite oils are citrus oils. I love citrus oils. When we began doing hospital research, and we started that in 2010, was the first time that we did that. And we began introducing essential oils into the hospital environment. Citrus oils is what we introduced. Part of the reason why we did that is that citrus oils, even though there's a lot of different types of citrus oils, have very similar properties one from another, even though there is some differences. We first chose to do a model of diffusion in our first hospital. We diffused citrus oils for 5 years, 24 hours a day, 7 days a week. We didn't even have one adverse event, but we had very positive effects in the study that we did for those 5 years. So we know them to be powerful. Now, everyone has individual preference with the citrus oils. And that's one of the reasons why I like this category, is that lemon does not smell like wild orange, and yet they have some real similar properties. And so this is a category of oils that you can turn to, that you can share with others and let them choose what their preference is. We so much of the time feel like we have to force somebody into, you have to like what I like, or you're not thinking correctly. You have to use this oil. But they can choose any of the citrus oils and have great success with that. They also all contain one key component, which is called limonene. And limonene is effective for a few different reasons. One is that limonene offers cell protection. Now, it does that by stimulating a very specific process in the body, which is glutathione production. Every single cell in your body needs glutathione, without exception. And your body has to produce its own glutathione, and one of the things that we have learned about limonene is that it stimulates the body's ability to do so. So it acts as an antioxidant. It also works in the body's immune capability. Now, it's a monoterpene, and if we look at monoterpenes in its full capacity, all monoterpenes are anti-infectious within the body, so that becomes very powerful as well. Now, if we look at glutathione, something interesting happens with glutathione. This happens naturally, so don't worry, you don't have to try to do this. When we're young, if you're like Dave Sterling and you're here somewhere in your 20s, you have high amounts of glutathione in your body. If you're like me and you're somewhere like right here, you generally have very low amounts of glutathione in your body. And that's because the efficiency at which our body can produce those things metabolically begins to diminish for a variety of different reasons. And so over time, this very critical antioxidant, which is sometimes referred to as the master or the mother of all antioxidants, it actually has the capability of regenerating antioxidant function within your body. So as an antioxidant has outlived its useful life, it pairs with glutathione and it can be rejuvenated. It donates to it some of its chemistry, in this case a molecule, and it's able to or an electron, it's able to go out and once again be productive. It protects your cells from the inside out. The body's capability to do that, if it diminishes, it becomes really important to think about the citrus oils because of their high concentration of limonene. Now, we have a lot of citrus oils. We have lemon, we have wild orange, we have grapefruit, we have bergamot or bergamot, you can say it either way. We have lime, green mandarin, which comes from right here in Brazil, which you'll have very soon. Green mandarin is added to that list. And tangerine is also added to that list, which we'll provide for you starting today. So lemon, cleansing and immune support. Wild orange is soothing to the tissues and it's protective to the cells. Grapefruit aids in digestion and it supports a healthy metabolism within the body. And then bergamot is a little bit different in its chemistry. It's anti-stress. Helps to soothe the emotions and the stress responses in the body and calming to the muscles. And then finally, lime is really good for respiratory function. And I've said several times now, lime and thyme is a good combination. Lime and eucalyptus is a good combination. Lime and rosemary is a good combination. So that helps you to understand how we might break those oils into specific category. And so let's look at limonene now. Limonene, this was a really interesting study that was done on limonene. They took a patient set and they looked at limonene and they all had various degrees of very specific tumors. skin tumors. And one of the things that they noticed, and they were looking to see, would limonene be effective in treating the tumors? And so as they administered D-limonene, they found that it was effective and it greatly reduced the amount of tumors that were present. So they proved their theory, but they noticed something else. In all of the patients and all of the subjects that they looked at, they also noticed that every single one of them had very low amounts of glutathione present in their body. And when they administered D-limonene, the glutathione was restored to normal levels. Now, Johns Hopkins in the United States, Johns Hopkins University has done a subsequent study where they found very similar things, that by administering D-limonene, like what we have in citrus oils, administering D-limonene, we can greatly enhance and restore to normal the levels of glutathione. Now, the real advantage here to this information is that you can't take glutathione as a supplement. You eat lots of foods on an everyday basis that have glutathione, but your body breaks them down into their individual amino acids. And then your cells have to reconstruct their own. And for whatever reason, we know that limonene stimulates that building of glutathione for restoration within the body, protection of the cells from the inside out. And so that's substantial. And this is why I'm excited about tangerine essential oil for you. Both grapefruit and tangerine and wild orange have more than 95% pure D-limonene. That means it's a dominant feature for them. And so now we're adding for you tangerine in that lineup and that ability for you to start taking advantage of that. Now, glutathione, limonene does other things for you as well. So just like the brain is a very sensitive area of the body, so is the liver. And it's critical that the liver have normal amounts of glutathione that's present. And one of the ways that we do that, of course, is through the limonene. And through the research, once again, we look at it and see that limonene greatly increases glutathione that's present within the liver. It's also good for digestive function, glucose metabolism, and cholesterol support. Citrus oils are an everyday essential oil. You need to practice using citrus oils every single day, and here's a good way to do it. In my home, diffusion of citrus oils is a daily practice. In my office at work, I diffuse essential oils, and specifically citrus oils, on a daily basis. And so that's a good methodology for you to begin to use. Combining it with lime or eucalyptus for respiratory support, applying it directly to the tissues. The last one here, which is adding 1 or 2 drops in a capsule or adding it to your water, is a good way to access the limonene that we see in the citrus oils with consistency. Every time you drink, choose your favorite, grapefruit, wild orange, or tangerine, and just add a couple of drops to your water. That would be a good habit to get into. Or diffuse the oils, or put it in a capsule and take it at least once a day. So citrus oils are some of my very, very favorite. You doing all right? You still okay? It's getting hot in here, isn't it? Is it just me, or is it getting hot in here? It's hot, so I'm going to take off my jacket if that's okay, because it's too, yeah. When I take off my jacket, I'm sorry. Could somebody take my phone and record that and then send it to my wife? I would really appreciate that. That would be wonderful. Now that I don't have my jacket on, you see that I forgot my belt. So that's really convenient and nice too. All the flaws of Dr. Hill is starting to come through now, so yeah. You know, I have to tell you, I'm actually really proud of myself. Those of you who have known me for a long time, and those of you who maybe look at me now and go, oh, he's a little bit pudgy. He needs to lose just a little bit of weight. But I'm actually proud of myself. I've lost 30 pounds, and I'm working on losing at least another 10. I'd like to lose another 15. So you can do it. If I can do it, you can do it. So I'm showing off my new sleeker, slimmer belly. even though there's still a little bit there. So, all right, let's talk about inflammation. Inflammation is, let me ask another question. I asked this question earlier, and so let me ask a different one. How many of you know somebody with cancer? Raise your hands up high. Keep them up. How many of you know somebody with arthritis? Keep your hands up. Keep them up. If you need to, raise 2 hands. Raise 2 hands if you need to. Diabetes. Raise your leg up if you need to. Whatever you need to do. Every hand in the room virtually goes up. We all know people in this circumstance. We now know that inflammation is the cause of all major disease. It's a primary element of all disease. There was a time where infection was the driver of disease and illness. We got a handle on that some time ago, even though now that we're starting to see some resurgence. I read an article the other day of how polio is coming back, and polio is starting to be a problem again as things migrate and change. More value for the essential oils, I suppose. But now infection is a really hard thing. When we talk about diabetes, that's an inflammatory metabolic disease. When we talk about arthritis, that's an inflammatory disease. When we talk about cancer, it's an inflammatory disease. And part of the reasoning for that is not just what happens metabolically, it's what happens physically. And so to give you some idea and to make this link that whenever there is inflammation, and inflammation is chronic inflammation destroys tissues and causes pain and discomfort. And so this is a really good example of that. On the left, you see a normal thoracic and lumbar spine. You see that the person is straight and erect. There's lots of disc space that exists between each of the vertebrae. And the person on the right is not so fortunate. And you can see that the spine is actually collapsing on itself, that the disc space is diminished. There's some anterior cupping that exists. There's even on one of these an anterior prosthesis that's there. Anyway, this is me. This is my spine. This is what I deal with on a regular basis. Now, people ask me all the time, well, what do you do? I went to a good friend of mine not too long ago. One of the things that I really enjoy doing is I like airplanes. I think they're fascinating. The beauty that you see is remarkable. And to fly an airplane, you have to go in periodically and you have to have a health checkup. And they check your eyes and they check your blood pressure and they check medications and they do a whole physical exam. And I went in for my checkup, and the person doing the examination on me, whom I've been to many times, said, Dave, you didn't list the medications that you take. And I said, I don't take any medications. And his exact words were, that's not healthy for you. And I thought that was the point. I didn't think I wanted to take medications. And so even in my circumstance here, which does cause discomfort for me, on a daily basis. It's hard to stand here sometimes for 4 or 5 hours because it becomes uncomfortable for me. I've adapted to that well. I think I carry myself well. But I do the very things that we're talking about today. I don't do anything different than you. I use the essential oils. I use our nutrition. And for me, trying to change my outcome and keep it from progressing further has been an exercise in the very things that we're talking about today. So I'm talking to you in the context of, for good reason do I say that that's the process that we're looking at. Now, there's lots of ways to categorize essential oils in this way too. In one category we can say is supportive to tissue response, meaning that it begins to block the cascade of inflammation. If we can stop the inflammation, we can stop the damage. The other is that we need to soothe the perception of discomfort. If we can take the pain away, we do much better. And we can do that with essential oils. Some of my favorite essential oils I've put into these 2 categories. Lemongrass, frankincense, and marjoram are all good at reducing inflammation, in addition to some of the other oils that we've already talked about. Clove, peppermint, and wintergreen are all good at easing the pain and the discomfort. Now, you've had an opportunity today to learn and to hear about deep blue. That fits into this category very nicely. Now let's talk about how we break these down. If we break oils down by where they come from, wood, mint, and spice. So you're familiar with spice oils: thyme, oregano, clove, cassia, cinnamon. Those are the oils we talked about today. Lemongrass, you could argue that it would fit into that category. Mint oils, so things like wintergreen or peppermint. And then wood oils, frankincense, sandalwood, cedarwood. Any oil, and we can be more refined than this, but any oil that comes from a wood, we can break it into 3 categories. All of them are good for reducing inflammation. Choose any oil. If it comes from a wood, say to yourself, I know it reduces inflammation. If it's a mint oil, I know it reduces inflammation. If it's a spice oil, I know it reduces inflammation. However, they have some differences. The wood oils are really good for healing the tissues. If we have tissue damage associated with the inflammation, they're good at helping to restore the tissues. When we look at the mint oils are really good at being numbing and cooling to the tissues. They take that pain and that irritation away. And if we look at the spice oils, they have a warming and a numbing effect. So peppermint is very cooling. The spice oils are very warming, but they're both numbing, and they take some of the irritation away. Does that make sense? So there's a good overarching category for you to look at and say, I can use any of the oils that fit into this category now. And instead of having 1 or 2 that you might be trying, all of a sudden you've got 15 or 20 oils that you can look at. You know, when we started the company, we had a very small amount of essential oils. And now we have a large number of essential oils, both singles and blends that are focused in many different things for you, helping you to be able to understand what to do. So one of my favorite oils in this category I want to talk to you about is frankincense. What? Yeah, well, this slides in completely what I'm seeing here and what I'm seeing here is 2 completely different things. It's really amusing. It's a lot of fun because I'll be talking about something and I'll turn around and look and like, that's not even what's up there right now. That's horrible. So let me talk with you about frankincense. And if you could, yeah, okay. Well, I'll just talk with you about this now. This is tuberous sclerosis. And tuberous sclerosis is a form of tumor formation within the skin. Now, it can happen in other areas of the body as well. It happens significantly and becomes dominant for people. And it's, as you can see, a challenge for most people. I show that picture to you because of this letter. This letter, I thought, was an amazing example of how people use the essential oils. It was from a young mother by the name of Heather. And I'll just read the letter to you. She said, "Dear Dr. Hill, we've been using frankincense essential oil now on our 3-year-old daughter topically for about a year. There's a couple of principles in here I want to teach you about using the oils. She has tuberous sclerosis, a genetic disorder that causes benign tumors to grow throughout the body. After reading some scientific studies on frankincense, I decided to start rubbing it on my daughter's nose to see if it would halt the growth of the angiofibromas, and it has. Her tumors have shrunk and the redness is gone. You have to look very, very closely to see anything at all. Thank you very much, Heather." What a remarkable letter that was to receive. Now, there's a couple of key points that are illustrated in this letter. First, on my 3-year-old daughter. We a lot of times feel like essential oils are not a family affair. And although how we use them with somebody very young versus how we might use them for ourselves, although the amount may differ, know that the essential oils really are safe for the entire family, and we should be able to use them for our entire family and those that we care about. The other thing that I thought was interesting about Heather's letter was she did some research and then she decided to start using the oils, but she did it for 1 year. She didn't try it for a week. She didn't try it for a couple of days. She did it for 1 entire year. A lot of times the outcomes that we see will take some time. Many people come to me, and while I'm very appreciative of this, and you need to know I'm always happy to try to help you. I really am. If there's something that I know, if there's something that I can share, I will want to try to help you. But many times people will come to me and I'll say, well, have you thought about this? Yes, I tried it, it didn't work. And I've learned to ask a follow-up question. How did you try it? When did you try it? Well, I put it on one afternoon, but I didn't notice any difference. Remember what we learned earlier. Oils, say it with me, oils is not what I do. It's who I am. We need to be able to use oils consistently. And I thought this was an excellent example how, not for a short period of time, but for an entire year, she persisted with her daughter and then saw the outcome that she was looking for. Sometimes the body takes a while to respond. Sometimes the body takes a while to heal and to change. So look for the consistency that's associated with that. Now, this is what we see with frankincense, and some of the reasons why that happened. We do know that it supports a proper immune response. Frankincense is unique in the wood oils because it has a specific set or category of chemistry called monoterpenes. The great advantage to monoterpenes as a category is that they metabolize quickly and we get fast response associated with it. And in this case, directly with supporting the body's immune capability. Nourishes the tissues, it's good for using over joints, for healing of those tissues, we talked about that. It's good for anxiety, creates a sense of balance, and it is a healthy cell function. Now, several years ago, I was speaking in Sandy, Utah. I don't know why I remember that, but I was speaking in Sandy, Utah. And it's the first time I introduced and said, frankincense is a daily use essential oil. I've given you 3 daily use oils now. Do you know what they are? On Guard, a citrus, and frankincense. These are oils that we need to learn how to use and share every single day. Frankincense, because of its ability to support good, healthy cell function and cell outcomes. Now, I came across some really interesting research. I shared with you about my wife who said, I don't know, I just like it, it makes me feel better. But I came across some really interesting research talking about frankincense specifically and how it can be supportive of the cells. One of the things that they said was that we know that frankincense has these inhibitory qualities for inflammation. We know that it disrupts that process. It is anti-inflammatory. But this research was very specific about changes that are occurring within the cell itself. Listen to what they said. They said when the DNA within the cell's nucleus becomes corrupted, quoting the researcher now, he says, it seems frankincense has a reset button. It can tell the cell what the right DNA code should be. Now, this is not new research. The first time I heard of research that was similar to this, talking about transcription errors with the DNA, with the RNA, with mRNA, was focused on frankincense and sandalwood. That was many years ago. And now here we are. This is research that was just done beginning of this year, was just released. And they're saying the same thing. Frankincense has the ability to reset the DNA. Remember what we said earlier. We said there's some things we know about essential oils. We know that they're biologically active. We know that they have specific cell targets, not just working on the surface of the cell, but have specific cell targets. Here's an example of a specific cell target. I have DNA that's disrupted. The primary disruptors of DNA, there's 3 or 4 of them. Poor nutrition, high stress, toxicity. Those are the primary things that we see that are disruptors of the DNA. And those are things that we're all exposed to on a regular basis. He went on to say in this research, frankincense separates the brain of the cancerous cell. When a cell becomes mutated, when DNA becomes disrupted and we have mutation in the cell, we're really talking about a cancerous cell. He says frankincense separates the brain of the cancerous cell, referring to the DNA, from the body, which is the cytoplasm, and it closes down the nucleus to stop it reproducing corrupted DNA sequences. Remember, one of the things we said about essential oils is that essential oils can be differentiating. I can stimulate apoptosis. In this case, this is not necessarily cell death, but I'm going to stop this cell from producing corrupted DNA sequencing. I'm going to disrupt that. How is it that essential oils can do that? Remember how we started the day. Essential oils are different than any other type of intervention that we see. And the difference is housed in its chemistry. This is why when I started talking with you about biological chemistry, why that's such a great find for us and that discovery and being able to now do that. Because we'll be able to uncover more of the reasons why this takes place. And although we don't know 100% the reasons, we do know that it does happen, which means frankincense is an everyday oil for us. I use it every morning. I put 2 or 3 drops under my tongue. There's times I put it on the bottom of my feet. There's times I diffuse it. There's times my wife rubs it on the bottom of my feet. Frankincense is an everyday use essential oil. And I have to thank Justin Harrison for this next sequence. I think this happened some time ago. I think it happened some time ago, and Justin shared this originally, and he gave me the pictures, and I shared this with not just the permission of Justin, but the gal who gave us the pictures. And I don't remember all of the specific details, so I'll apologize to Justin up front because it's been many years ago. But this is a woman who was in a motorcycle accident, right? She was in a motorcycle accident, and this is her first day in the hospital. Now, as a doctor, you look at this and you become concerned about several different things. One is possible infection within the tissues, and the other is what about scarring and healing of the tissues? And you can see she was not in a very good way. Now, kudos to her because she did go to the hospital. But when she got released from the hospital, this was the first day after she got released from the hospital. This is what she looked like when she went home. And she made a decision that she was going to use frankincense. And Justin, do you remember what the other oil was? Frankincense, myrrh, and lavender. She used those 3 oils together. I could remember frankincense, and I knew there was another one. Frankincense, myrrh, and lavender. She used those 3 oils in combination. Now, what she didn't do was put the oils on and just rub it on her face. You can imagine that she wouldn't do that. So she used the spritzer, and she spritzed the oils on her face. This was day 1. And after starting that routine, this is day 3. And then day 6. And then day 10. Day 10. Oils work. Oils are biologically active. Now, how does it do that? It doesn't defy your body's chemistry. It works within the bounds of your body's chemistry. But it does it in a way that's complete. Now, remember how I categorized this oils. I said wood oils are anti-inflammatory, but they're also healing to the tissues. And so when we look at this, what don't we see? We don't see scarring. We see complete healing just after only 10 days of starting to use the essential oil. So there's many, many, many opportunities for us to share more things like that as we go forward. Lemongrass. Let's talk a little bit about lemongrass. Now, I like lemongrass. It kind of is in this mix between an herbal oil and a spice oil. But it is a good, strong anti-inflammatory oil. Now, I like using it topically. I told you about how I've used lemongrass for my mother along with oregano for her arthritis. and that was very helpful. And so it eases joint discomfort. It can be clarifying to the skin. We do have some skin care products in doTERRA where lemongrass is an actual part of some of the skin care because of its clarifying qualities, strong antimicrobial qualities for the skin, not as aggressive as some of the other oils that would fit into this category. Internally, I like using this oil because it's really good for circulation. Now, it's good for GI issues, it's good for preventing damage to the cells. Earlier I said lemongrass is one of the oils that has been studied and was found to be able to differentiate and to stimulate apoptosis and yet be cellular protectant for healthy, normal functioning cells. One of the reasons why I really like lemongrass, however, is because of its ability to be sustaining of normal cholesterol levels within the body. Cholesterol is interesting within the body. Cholesterol can develop because of high amounts of toxicity. Cholesterol can develop because of high amounts of stress. Cholesterol can develop because of poor nutrition in the body. Ironic, all of the same things that we've been talking about with inflammation. And so using, in this case, lemongrass, 1 or 2 drops in a capsule once a day is a good practice to start looking at and monitoring normal, healthy levels of cholesterol. One of my favorite oils to use clinically in that regard. However, we are talking about inflammation. And this was a really interesting study that was done. So some of the oils that we talk about have this more global response, like Deep Blue, for example. Some of them have very specific response. And when we look at pain within the body, there's different types of pain. There's different pathways for pain. And in this is a neurological pain that they're referring to that's established in the periphery. It can happen for a variety of different reasons. And if we have hypersensitivity within those peripheral nerves, we can have a lot of global discomfort, widespread pain. And here's a study that was done where they looked at lemongrass, and what they found was that lemongrass was a great, it's not an analgesic, but it does have analgesic-like properties, meaning that it eases the pain and the discomfort when it's used topically. So think about using this as a targeted approach. Maybe it's a knee, maybe it's a hip, maybe it's on your spine. Think about using lemongrass to help control some of the pain and discomfort. Now this was so successful. Excuse me, yeah. Now this was so successful that this is now being looked at, the chemistry that's involved with this. And I'm going to use this to make a point. We've seen this a number Wait, I am so sorry. Please forgive me. And now I've got someone else's peppermint. My whole goal is to get all the peppermint in the room before I leave. I don't know why I'm coughing so much. Please forgive me. You're very kind to be patient with me today. Yeah, Justin says I've been talking for 3 hours. That's why. Okay, let's talk about this. So what they would like to do with this is they would like to make this into a drug. I'm going to tell you why that will not work. Why it won't work. It won't work because of the fact that when we isolate chemistry, there's something interesting that happens with the essential oils. And when we isolate individual components, they do not create the same effect that they do within the essential oil as a whole. Now, we saw this in lots of models of the research that we've done. One of the partners that we've had for research is Johns Hopkins University in the United States. We looked at every single, remember the big list that Dave Sterling showed you and said, here's every single oil that we have, here's all the, oh, thank you very much. Here's all the ingredients that we have for the blends, right? Every specific oil for all the blends and singles. That was a big, massive page. We looked at every single one of those essential oils at Johns Hopkins. I received a phone call from the lead researcher. Her name is Dr. Nicole Parrish. And Dr. Parrish called me in my office and she said, you won't believe what I just discovered. Now, when we start looking at bacteria and other things, there's lots of variations. There's gram-negative and gram-positive. gram-negative is much more difficult to deal with, and it has to do with the structure of the membrane of the organism itself. Gram-positive is a little more easier to deal with. So we looked at all of those different strains, and she called me and she said, I have found 2 oils that are 100% effective against all gram-negative and all gram-positive. Do you know what the 2 oils were? Any guesses? Oh, thank you. I'm good on the oil. I got another. Okay, I'll take your oil. Yeah, thank you. Boy, if only I had some frankincense oil. Thank you very much. No, I'm okay. I'm okay. She called me and she said, we have 2 oils that we found is effective against all gram-positive, all gram-negative. And the 2 oils that she discovered would do that really surprised me. One was cilantro essential oil. That surprised me. The other one was rose essential oil. That surprised me as well. I was confident that maybe it would be oregano, or maybe it's thyme, or maybe it's on guard, or maybe it's a combination of some oils, but it was those 2 oils singularly. And so they wanted to conduct a series of experiments. They were very excited. And she said, Dr. Hill, this is groundbreaking. This is new drug territory. We're going to develop a new drug together. And I thought, I don't want to develop a new drug. We already have the essential oils. And so they began isolating the chemistry. She called me again a few months later and said, we've narrowed it down to the aldehydes. We know it's the aldehydes. And I've narrowed it down to 2 or 3 very specific aldehydes within cilantro. This is incredible. She was so excited. And I shared with her that don't be disappointed when it does not work. And eventually she narrowed it down to the chemistry that she thought would be effective. And as they conducted the tests to repeat the outcomes, they were ineffective. They didn't work. It's the construct of the whole of what we see within the essential oils that is making them so very effective. So here's another example of where somebody says, oh my goodness, if we just concentrate and if we isolate the myrcene, which is the compound that they were looking at, then we can develop a drug and it will work just as well. But it does not. It's a different chemistry model in its entirety. Even in how it interacts with your body's own cells is very different. And so the value of the oils and the value of research is not when we isolate molecules. It's when we begin to realize how the oil functions as a whole and some of the benefits that can come from that. So here's some simple ways that you can take advantage of the oils that we just talked about, in addition to using the deep blue that you learned about just a little bit earlier today. Now I'm going to move on just a little bit out of the interest of ensuring that we can get through everything that we want to. Are you still okay? We are down to our last hour, if you can believe that. We've been going for 3 hours. We've got 1 to go. Thank you for being patient and thank you for letting us go through this. So let's push on just a little bit and let's talk now about copaiba. Now you have to be excited about copaiba. It is right here in Brazil. Several of you have asked me, is this your first trip to Brazil? No, it's not. I was here several months ago. Myself and Emily Wright came here and we went up the Amazon and the Black River, and we have lots of growers who are there. And we began establishing our opportunity for copaiba in a much greater way right here in Brazil. Now, copaiba is a little bit unique because of its rich content of beta-caryophyllene. Now, we have a little video. It's going to go for 3 or 4 minutes, but it really begins to explain to you why we're so excited about copaiba. So let's go ahead and roll that video.
Até agora ninguém descobriu de fato todos os benefícios da copaiba. Embora ela já venha sendo usada historicamente, somente agora estamos de fato começando a entender a ciência por trás disso. E acho que os benefícios deste óleo ainda não foram completamente revelados. Foi preciso esperarmos até depois de janeiro para que as águas subissem e pudéssemos acessar as árvores. A estação principal da coleta ocorre entre janeiro e junho, quando a água está alta. Agora vamos subir e ver as árvores de copaíba de perto e ver como eles coletam a resina. A maneira como a resina oleosa é extraída é a seguinte: a árvore é descascada como se fosse um pé de bolo. À medida que a árvore é pressionada, a resina oleosa é coletada. Depois poderemos extrair esse óleo que escorre. Faz cerca de 1h30 que a árvore foi perfurada para coletarmos somente esta quantidade de óleo. Isto ajuda a entender quanto trabalho é preciso para se coletar este óleo, que após ser destilado vai render apenas 50% desta quantia. Ele vai voltar a estas árvores 6 meses depois e poderemos obter cerca de 1 litro de resina desta árvore.
O óleo de copaíba atingiu a comunidade científica como uma estrela cadente. Nós não entendíamos completamente o que ele tinha de tão especial até começarmos a receber os resultados das pesquisas sobre o beta-cariofileno. Então entendemos que o beta-cariofileno entra e interage com o receptor na superfície da célula. Pense nas janelas da sua casa. Seriam coisas interagindo com a sua janela e mudando o que você faz dentro da sua casa. Você não entra em contato com elas, mas elas mudam o que você faz. Se você vê chuva na sua janela, pega um guarda-chuva e usa uma roupa diferente nesse dia. Então a ideia é a mesma. Temos elementos interagindo com a superfície da célula que mudam o que acontece dentro dela. Há uma cascata. Há uma reação em cadeia das coisas que acontecem quando este receptor é ativado e outras moléculas da célula são despertadas e começam a mudar e interagir com outras coisas. Por fim, o que acontece é que o DNA dentro de um núcleo começa a funcionar e diferentes genes são regulados para cima ou para baixo. Outras moléculas sinalizadoras aumentam ou diminuem em quantidade.
Temos uma força auxiliar que pode chegar ao sistema imunológico do corpo, às funções imunológicas do corpo. Temos uma força auxiliar que pode chegar ao sistema endócrino do corpo. Se você combinar essas duas coisas, e agora estamos falando do perfil químico do corpo, especialmente através do sistema endócrino, muitas vezes sentimos desconforto de formas diferentes e podemos inibir esses processos no corpo. Podemos impedir que eles ocorram. Muitas pessoas têm resultados notáveis de diversas maneiras diferentes para o desconforto que estão sentindo. E o produto final que estávamos buscando era exatamente igual ao que encontramos nessa planta. Isso requer muito tempo, muita experiência e entendimento dos materiais com os quais você está trabalhando e até mesmo da singularidade da química. Quer tenhamos componentes dominantes ou mais sutis dentro do óleo, cada um deles desempenha um papel importante no valor da constituição geral do óleo e nos benefícios que esperamos obter desse óleo.
Uma coisa única a respeito do óleo essencial de copaíba é que usamos 4 espécies diferentes de copaíferas. Isto cria um perfil muito completo. Talvez outro óleo de copaíba oferecido seja apenas uma fração ou apenas uma parte de todos os componentes disponíveis a partir de espécies diferentes. Mas nós usamos as 4. A razão de fazermos isso é para criarmos uma sinergia única por meio da química. Não estamos apenas buscando pureza, mas também potencial. As árvores não são prejudicadas de forma alguma e esta é uma maneira sustentável de coletarmos o óleo essencial. E acho que o potencial para este óleo é imenso. Há tantas árvores, seremos capazes de criar centenas de empregos e isso só aumentará com o tempo, conforme levarmos este mercado ao mundo. Adoramos ver como é produzido, adoramos ver como é coletado, como é destilado, mas a parte mais importante para nós é nos conectar com as pessoas que estão trabalhando lá para nós. São pessoas reais, a vida delas importa. E para nós poder conhecê-las de verdade, conhecer com o que a família delas lida, suas necessidades e sermos uma coisa só, é a parte mais linda.
Um presente que nos dá vida, a vida da
tell you that I love this essential oil. We go through quite a process when we're getting ready to launch an essential oil, trying to decide, does it fit into our categories? Are we going to be able to have it meet the profiles that we need? Can we accomplish all the tasks that are involved with that? I'm a little embarrassed to tell you that when we first started talking about Copaiba, I was a little bit of a naysayer, saying I'm not so sure that that oil will prove to be very valuable for us. Let me look at the chemistry. And so for the next several weeks or a month or so, I began looking at the chemistry in great detail. And I became convinced very, very quickly that Copaiba was an essential oil that not only we needed, but that it was an essential oil that would become quickly one of our most popular essential oils, which it has. So the whole world now thanks you for your Copaiba that you're providing for us here right in Brazil. So thank you for doing that. Now, as you saw in the video, Emily and I had an opportunity to come here, and it was a unique experience for us because we also sourced some citrus oils from here further south. So we divided our time between Copaiba and then working in some of our citrus operations and just seeing what was happening there. As we went up to, I'd never been to Brazil before. And Brazil is a beautiful country. It's breathtaking. And as we went to where we needed to go to, I learned about the Amazon River and the El Negre River and how they don't really combine together for many, many miles, right? And that was a very interesting feature to me. And I thought to myself as we were making our way about how beautiful that was. But I didn't really see the beauty of this country until I started to meet some of these individuals. This to me is the antithesis of everything that we talk about in co-impact sourcing. I'm always fascinated when one of my partners talks about co-impact sourcing because it has personal meaning for each one of us. One of the things that we learned as we went up the Amazon and then as we went into some of these smaller villages is how compartmentalized these harvesters of Copaiba are. The necessities that they're lacking and that they don't have. Dave did such an eloquent job this morning of explaining to you how we build hospitals and schools and do all of these remarkable things. That is not going to feign here in what we do in Brazil either. We are working feverishly to help all of our growers here. We've already changed their social economic circumstance. As we arrived, some of they're not pictured here, but members of this family were having a lot of struggles. They weren't well, and I had opportunity to spend a little bit of time with them. And we used the essential oils. We also learned that they were not able to provide medical care for themselves. They're 2 hours to 3 hours up the Amazon in their boats, and they don't have the resources to travel to get the medical care and attention that they need. And their teeth had become impacted and had rotted down to the gum line, and they were in a lot of pain and agony. Do you know which oil I used for them? Clove. I used clove oil. I gave them each a bottle of clove oil. We also paid for them to be able to make the journey to go to a dentist to receive some proper care. When we come into an area like this, and why this is happening and occurring right here, is because as traders come up the river to provide for them commodities in exchange for their Copaiba, they become indebted to them. And after working an entire season, this family shared with us how we work an entire season and we provide everything that we have to these traders, and we are still more than $2,000 in debt at the end of the season. And so now we're in debt for next season. We've broken that cycle. We've broken that chain. We pay them now fair market value, and they no longer are under that bondage and that difficulty. Now, the other thing that we're doing so aggressively is that we're working with them to give them the ability to expand their operations. And it is quite a neat experience. As we went up as far as we could go in boats, and then we got out and we walked through the jungle. Now, I was fascinated with Dave's this morning, his story as he talked about having to deal with sultans and airplane batteries that didn't work. Well, Dave, I got you beat. We didn't have an airplane. We were walking through the jungle. We had machetes, Dave. We were going through the jungle. And I kept noticing that there was these burrows in the ground. And I kept asking, what is in there? And they would just kind of, oh, nothing, just keep walking. And we had been out for all day. We'd been like 8-10 hours of hiking and trying to find copaiba trees, trying to expand our operation, do the things that we needed to do. And on our way back, we were hiking back to where we had left you saw the little boat that we were in, where we had left that boat. By the way, it's really comforting to go up the Amazon in a boat that's about this far out of the water. It's really a good thought, thank you. Especially when you start thinking about the piranhas and other things that are in that water. I learned that was the least of my worries, and as we're walking back, I kept asking the same question all day, what are these burrows? And finally, one of the individuals who was with us, who was serving as an interpreter for us, said, you shouldn't be looking down, you should be looking up. I said, looking up, why? And right in front of me was a big spider about yay big around. It was from the family of the tarantula spiders, but very aggressive and somewhat deadly. And it was just right there at eye level in the tree. He goes, we've been laughing at you all day because you keep looking in the ground, and we've been walking by these big spiders all day long. They burrow in at night, but during the day they're in the trees to hunt their prey. And so that was an interesting experience for me. We went to a tree, and this is quite a process when we liberate that resin from the tree. This is not an easy thing. The whole process for him to drill this tree, because he drills it in 2 spots, was almost 3 hours long to get any resin whatsoever. And then I think you heard Emily say in that video about the yield of the essential oil itself from that resin is much, much less. Now, if I were you, I would have a resounding question, which would be, why should I buy copaiba from you? I live here in Brazil. I could get copaiba. I think it's probably replete, at least in some circumstances and in some opportunities, you see it a lot. However, remember what you've learned. You don't see what we have in those other places. And let me expand that just a little bit and build some value into why this copaiba. One of the things that we discovered very quickly when we came here into the marketplace as we were exploring this essential oil and making these decisions is that the common practice with copaiba is not to separate the oil from the resin and just sell them as oil by itself. So it's an oleo resin oil. And the problem with that is that we don't get all of the density of the essential oil that we normally would like to see. It's a model of dilution is what it becomes. And so as you learned about dilution a little bit earlier today, it's just not as effective. It's not biologically active. It doesn't do the things that we need it to do. Now we've enhanced that even more by not just extracting only the essential oil and separating those out, but we've taken 4 different species of copaiba and we've blended them together. Now you might ask, why did you do that? Remember when we talked about CPTG and I said there's purity, that's all of our analytical chemistry, but there's all of the biological chemistry that we do to define therapeutics. And one of the things that we discovered is that when we looked at the species individually, it didn't really provide the benefits that we were looking for. It was only when we blended 4 species together that I began to say, this is going to be a powerful oil for us. This oil has value because of the therapeutic benefit. This is not something that other people are doing. And the ratios of that is proprietary to doTERRA. So it's more than just that copaiba is available elsewhere in the marketplace. It's in a completely different context that it's available. And for the value that we need and that we want it in the context that I just described. Now let me tell you what that context is, at least in part. Part of it is in looking at the endocannabinoid system. Now, you may or may not be familiar with all of the research that's been happening now for a long period of time, talking about the endocannabinoid system. In the United States, all the rage right now is hemp oil and CBD oil. And you probably have some of that same discussion that's happening here. And so let me bring some clarity into this discussion and tell you why doTERRA does not have those oils, because they're inferior to what we can do with the copaiba is the main reason. And so let me explain those to you. The endocannabinoid system is a system that exists within your body that has two primary receptors. One is called the CB1 receptor, and that's generally localized to the central nervous system. And then the other is called the CB2 receptor. Now, these are proteins that can interact with cannabinoids. And the CB2 receptor is a much more global distribution in that it has strong effect within the endocrine system, within the immune responses of the body, as an anti-inflammatory agent within the body. And so there's a lot of value associated with being able to entice the CB2 receptors. CB1 receptors, when we activate those, they come at a price. Let me explain that to you, because there are three main types of cannabinoids. Now, a cannabinoid is anything that interacts with the cannabinoid system, whether it's CB1 receptor or CB2, doesn't matter. It interacts with the cannabinoid system, and so the endocannabinoid system, so that is a cannabinoid. And the plant cannabinoids that we know of are focused into three primary groups. One is cannabidiol, CBD oil. Now, the problem with CBD oil, if there is one, is usually twofold. One, it doesn't ever meet our quality standard. Cannabidiol does not exist in any sizable amount or quantity in the CBD oil, which means it has to be synthetically added into that. It's just not liberated through any of the processes. It is in the plant, but it's not found in the essential oil. And that goes contrary to everything that we ever said about essential oils and quality. And so we won't ever do that. The other challenge that we have is that CBD is not a direct response within that system. It works, but it works by cascading through several other steps to influence the system rather than interacting with the receptors themselves. The other one that we see is tetrahydrocannabinol, and tetrahydrocannabinol is THC. This gives the hallucinogenic effects that many people talk about. And in hemp oil, which is different than CBD oil, there's high amounts of THC. We're not interested in hallucinogenic effects associated with that. That happens because it overwhelms the cannabinoid system and the CB1 receptors in the brain itself, in the central nervous system. For us, that's a non-therapeutic benefit and not what we're looking for. And so we then extended and began looking at beta-carotene. And beta-carotene as an endocannabinoid, as a cannabinoid stimulus, is really powerful and effective because it not only works with CB2 receptors directly, we don't have any of the unwanted consequences associated with overstimulating the central nervous system. So we have something that does exactly what we want it to do therapeutically, in a direct sense. And because of what we've done in combining the four species together, it does it better than any other copaiba that we have found. And so that gave us the therapeutic outcome that we were looking for. Now, there's other essential oils that have good amounts of the beta-carotene. This is not unique to copaiba. Black pepper was the closest one we have at 21%. Juniper berry only has 5%. Oregano, which I talked about earlier, only has about 2%, so even less. In the copaiba, we have more than 50% beta-carotene. So a substantial amount is present within that essential oil, which is part of what makes it so beneficial and so effective. Now, beta-carotene, even though it works with the endocannabinoid system, it has targets outside of that system too. That's not the only thing that it does. And this is where I also began to become very excited about copaiba as an offering of an essential oil. It works with the liver as an antioxidant. It protects the liver. The liver, everything that happens in your body chemically at one time or another has to go through the liver. And the liver needs some extra care and support. And copaiba is a good way to deliver that. Cardiovascular health, immune health overall, digestive support, neurological function, supporting the neurological system, supporting the respiratory system. These are all additional benefits that we see from copaiba. So let me narrow it down for you, because we can use this oil in 3 specific ways. We can use it internally, we can use it topically, and we can use it aromatically. So let's talk about using it internally for a minute. I like using it in a capsule. I'll be honest with you, I don't like the taste of copaiba. It's an acquired taste, I think, at best. And so I put it in a capsule, and I might use frankincense directly under my tongue and take 1 or 2 drops of copaiba in a capsule. I usually do that in the morning. Sometimes I blend it with the frankincense, because remember, they're both cell protectants. They're both very supporting of the body as a whole, overall. You can do 2 drops under the tongue or blend it with peppermint for good digestive support. Those are my favorite uses for using that oil internally. Now, we can do it more than just using it internally. Neurological excitability. This is just a clever way to say that there's lots of different reasons why we have pain. More than just inflammation, there can be other reasons as well. And one of the things that is a strong benefit that comes from using the copaiba oil is it does act and respond as an analgesic. It blocks that pain. It does not transmit, and it begins to diminish very, very quickly. So I like using that topically, and here's one of the reasons why I like using it. One is I can apply it directly over the area. It can be very targeted in how I use that essential oil. Combining it with flower oils, oils like blue tansy, or oils like lavender, or geranium, or lang-a-lang. There's any number of flower oils that you can choose. Combining it with that is a great way to help reduce and diminish skin irritations. Sometimes we have an inflammatory response within the skin. Sometimes we have cuts and abrasions. We have skin damage. We have bites and other things. Think about using copaiba with a flower oil. Choose your favorite one. And then blending it with your favorite moisturizer. Or blending it with cedarwood helps to support the matrix of the skin. That deeper structure of why your skin looks the way that it does. It stimulates collagen, type 1 collagen, it stimulates fibroblasts, and it stimulates elastin production within the extracellular matrix. So very easy and simple ways that you can use copaiba topically. And then lastly, aromatically, we normally don't talk much about this, especially not when you have an oil that's such a powerhouse about using it aromatically. But I think there's lots of reasons why we would want to. Remember, it has activity outside of the endocannabinoid system. And one of its primary benefits is for respiratory function. Now, it has a very unique aroma, which I find pleasant. But again, for respiratory issues, think about blending it with eucalyptus or with lime would be a good choice. Combined with citrus oils for mood, a beautiful combination is to look at an oil like Siberian fir and combine that with the copaiba. And that also gives it a very beautiful aroma and its own unique ability to create relaxation. So now let's talk a little bit about blending the oils together. When we blend essential oils together, that creates its own unique form of synergy. And there's lots of reasons why we would blend an essential oil together. And in doTERRA, we have a lot of different blends. You learned about Deep Blue today. I want to just talk with you. You learned about On Guard today. I'll come back another time and I'll talk with you about all the blends as a category. But I do want to talk with you about one more blend today, which you're going to receive, which is the Aroma Touch blend. Now you're not excited about the Aroma Touch blend? Now let me walk through this process of why blending the oils together is so significant. Now, I've shown this for a long period of time, and for the chemists in the room, you're going to want to become very critical of me, but if you do, you'll be wrong, because what I'm describing is how chemistry works together. I sometimes will say when we blend chemistry, you change chemistry. And all the chemists in the room become very frustrated with me, and linalool does not become something else if you combine it. No, it doesn't. But whether or not it's dominant, what the overall function of blending those oils together is can and does change depending on how they're blended. So this is a good illustration of this. I took 3 essential oils. I took melaleuca, I took peppermint, and I took lavender. Now this is a GCMS, however, it is not a quality test. We did this for a very short period of time just to get a baseline of chemistry. We only did this test for 20 minutes, where normally we might do this test for more than 2 hours. We might run this test so that we see all of the detail in the chemistry. I just wanted a basic profile to illustrate my point. And you can see that there's some similarities between them, but you can also see as you look at each one of these peaks that there's some differences that's cataloged and noted in each one of them as well. And so melaleuca, peppermint, and lavender. And then what I did is I did an interesting experience where I created 4 different blends. Blend number 1 is here on the bottom, and then 2, 3, and 4. And I used the exact same oils, the exact same amount of oil, but I changed the way that I blended the oils. In other words, first I might have used lavender, and then peppermint, and then melaleuca. And then in the next blend, I used melaleuca, and then peppermint, and then lavender. And then I used melaleuca, and then lavender, and then peppermint, and so forth and so on. Same oils, same amount. And you can see that there are some similarities and there's some differences that exist between them. For example, in blend number 1, or blend number 4, 3, and 2, these top 3, they have some real similarities between them, especially in comparison to blend number 1 that's here on the bottom. Now, if I were to ask you, which blend do you want, which blend would you choose? Blend number 1, 2, 3, or 4? Which one would you want? Everyone always says, I want blend number 1. It depends on what you're trying to accomplish, doesn't it? Even though the chemistry profile looks very different, and this seems like that would be better, it might not. It depends on what we're trying to accomplish. So when we blend essential oils together, we go through a process that I've identified with my teams as therapeutic balance. Now, this does not mean that you're going to go to some physiology book and you're going to look it up and you're going to read all about therapeutic balance. I made that term up. But I made it up because it defines perfectly the process that we go through and that our teams follow. A lot of people, when they blend essential oils, in the perfume industry, for example, it's purely an aromatic profile. I don't care about anything but other than what the aroma of that blend will be. And so it doesn't matter what any of the therapeutic benefit is. I don't care what the chemistry is, because I can just change and alter the chemistry in that industry. We don't have the luxury of doing that, but we are concerned about aromatic profiling. And one of the things you've noticed about our blends is that they all smell beautiful. They have wonderful attributes that way, and we have entire lines that are meant just to be used aromatically that you'll be introduced to a little bit later on. Also, we can look at oils for physiologic benefit. I don't really care what it smells like. I don't care what the chemistry is. I just want to know what the outcome's going to be. And once again, this becomes a model in most areas of dilution or change or adulteration. In doTERRA, this is a careful orchestration between what happens aromatically and what happens physiologically by not taking and removing individual chemistry, but entire essential oils, changing the balance, changing the order with which we add them, changing the amount of one versus another. It's a delicate process. And then when you add the last one in there is what happens chemically. We look at the essential oils to know this is great, it smells great. Physiologically, it seems like it would be okay. But when we look at the chemistry, this chemistry is antagonistic to this chemistry. And so we look for processes or chemistry that's complementary. And we balance all 3 of those very, very carefully. Now, one of my favorite blends in all of doTERRA is a blend called Aroma Touch. Now, the reason why we created Aroma Touch was primarily because of muscle tension. When muscle tension, when there's anoxylitic circumstances, or when we're under stress, we develop muscle tension. And it can be problematic, it can be long-term, and it can be very painful. And so we look at the oils that are associated with AromaTouch: cypress, marjoram, peppermint, basil, grapefruit, lavender. All of those oils are formulated together in that perfect balance, that perfect blending balance that we talked about, therapeutic balance. Each one of those oils, if we look at them chemically, are supportive of one another in helping to stimulate blood flow. We also know that they're supportive aromatically because of the beautiful aroma with the blend. And if we look at what happens in terms of the physiology, it's calming and relaxing to the tissues. So this is a really good example of how we've blended those things together. Now there's a tension cycle that develops in the body. And it deals with when we're under stress, we get hypoxia or a lack of blood flow. Oxygenating the tissues is now insufficient. We have pain, we have a toxic insult, and muscle tension and spasm begins to develop. The AromaTouch can break that cycle. Now, how many of you are familiar with the AromaTouch technique? Not very many of you? Well, this is good news because I'm going to talk with you about the AromaTouch technique. Now, this is the ways that I would recommend that you consider using the AromaTouch blend, but I would also tell you it's a significant part of the AromaTouch technique. Now, there's 6 reasons why we're going to teach you the AromaTouch technique. Now, our original plan was to teach the AromaTouch at this event. We think that we need to do a little bit of preparatory work before we can do that. So we'll be back sometime this next year. We'll launch the full AromaTouch for you, a training program, and the opportunity for you to learn the AromaTouch. I want to tell you there's 6 reasons why the AromaTouch technique will be beneficial for you and why you should learn that technique. The first is that it's an essential oil technique. It takes all of the characteristics that we've talked about today with the essential oils and the value that it brings, and it embodies it in one simple and easy to do technique. Regardless of your experience level, regardless of your knowledge with the essential oils, you can use the essential oil, and it's based in the value of the essential oils, not on the skill level of your ability to perform a technique. Number 2 is it is clinical. I drew upon all the experience I've had now for many, many years as a physician, but also all of my experience with the essential oils and what I know about them. And it is a clinical technique. It does offer benefits that way. 3, the benefits are duplicable. We needed something that wasn't just beneficial every once in a while, but every time you used it, we wanted the same benefits to be present. And then it doesn't provide reactivities and unwanted responses. The AromaTouch has a great measure of safety associated with it. I know it's getting late in the day and we're getting tired. Do you guys want to stand up for a second? You've been sitting for 4 hours. Stand up. Just stand up and stretch. If you leave, remember we're going to squirt peppermint in your eye as you leave. So stay with us for about another 20 minutes is all we got left. You can stretch and I'll just keep talking with you about this for a minute. Lastly, there's this circumstance in the body that's known as homeostasis. All of you right now are not feeling very energized, you're feeling very tired, and homeostasis has left your body. It has left the room because it's hot in here and it's been a long day. So let me tell you about the premise of why the AromaTouch and identify 4 critical things. In my experience as a physician, I learned, I feel like we should have somebody up here doing stretching exercises for us or something. Yeah, Lil, would you like to lead us? One of the things that I learned is that every patient who came to see me had challenges with stress. You can go ahead and sit down whenever you're ready. Had challenges with stress, had challenges with immunity, had challenges with inflammation, and had this lack of balance within the body. This balance within the body is not mystical. It's the ability of the body to be able to react and respond to different circumstances. It's called homeostasis. And there was always some element in every patient I ever saw who had either one or multiples of those four things together. The technique is focused on how it can overcome those, and it uses 8 essential oils. So the first one is we use balance and lavender together to reduce stress. And then we use melaleuca and on guard to support the body's immune response. And then for inflammation, we use aroma touch and deep blue. And then lastly, to help establish homeostasis, we use wild orange and we use peppermint. Okay, now we got a little bit of a challenge in that some of you are sitting, some of you are standing. All of you in the front are standing and everyone in the back is sitting. So maybe we can have everybody sit down. We really are almost done. I just got a couple of more things that I need to do, that I need to talk with you about. Yeah, sure. It's been a long day, I know it has. We did a study. We've been teaching and practicing the aroma touch now for 9 years, and we did a study. We wanted to prove out the value of the aroma touch and show its benefits. Now, nobody's ever seen this before. We just published this study in a journal, and we're really happy about that. But we wanted to explore those 4 parameters, knowing that everyone either deals with anxiety and stress, immunity, inflammation, or a lack of homeostasis. Does the aroma touch create an outcome and a benefit for them? And so we created a hypothesis that it would, and we looked at 4 very specific things. C-reactive protein and the cytokines are all important and revolve around inflammation. And so we wanted to look at those biomarkers and see if they were diminishing, and so therefore inflammation would also diminish. And then we looked at cortisol. Cortisol, one of these times we'll have a big long discussion about cortisol and how we can control that. But cortisol, if it remains elevated, among other things, diminishes your body's immune capability. It has other detrimental effects within the tissues and is pro-inflammatory. So we looked at cortisol and we looked at immunoglobulin A, which is a biomarker for the immune system response. And is the immune system functioning adequately? So those are the 4 biomarkers that we looked at. And then we created a study group. Now we recruited 18 people. We divided them into 2 groups. Now we did an IRB for this. We followed all of the steps you would expect us to be able to perform and do a peer-reviewed study. We followed all the scientific method. We divided them into 2 groups. One was going to be a test group, and then the other was going to be a control group. In the control group, the only thing that they received was fractionated coconut oil. They did not receive any essential oils. And then in the other group, they did receive the full aroma touch with oils. Now we had some other control methods in place. The control group thought that they were receiving essential oils, even though that they weren't. They thought that they were receiving essential oils. In the other group, we then tested them with the aroma touch, and over a period of a month, they received initially an aroma touch, and then we did an immediate test before and after the aroma touch. We wanted to establish the baseline to look at all of those biomarkers, and then we wanted to see the change that developed immediately after the first aroma touch. And what we found was pretty significant in terms of the change. And then we repeated a second and a third and a 4th week. At the end of the last aroma touch, they had 2 aroma touches per week. At the end of the last aroma touch, we did not repeat the test for more than 24 hours. We let them have the aroma touch, and then we had them come back and we looked at all of the biomarkers. And here's the results that we found. Immediately after the first session, so after they came in the first time, we established baseline, and then we did the aroma touch, and then we looked at the biomarkers. We did a blood draw immediately. And one of the things that we looked at, after the first session of the treatment group experienced a decrease in heart rate, a decrease in mean arterial pressure, and a decrease in anxiety scores. We used the scoring method that's used in psychiatry, so in medicine, and they had a decrease in all of those. And there was also a significant decrease in the amount of cortisol that was present. meaning that we eliminated and we reduced the effects of stress with an immediate sense and had some effect on immunity and inflammation as well. In an immediate sense, immediately following the aroma touch. At the end of the whole sequence now, so having several aroma touches, 2 a week for several weeks, and then doing our last draw, even though we did some each week so we could see the progression, I'm just reporting on the last draw. Long-term effects included significant reduction in C-reactive protein, inflammation, and diastolic blood pressure. There was also a reduction in all 4 cytokines tested. So what we found, in an immediate sense, we have some superficial effect that exists with discomfort, but we had great reduction of stress. And then over a period of 2 a week for 3 or 4 weeks, we began to see significant reduction in inflammation, and the body came into a state of homeostasis. I'm really happy about this. When I developed the Aroma Touch, it was based in all of my knowledge and experience, but we had never scientifically tested nor published any studies about the Aroma Touch until now. And so our desire is to bring this to you. Our desire is to let you to begin to experience what the Aroma Touch is, okay? And so we'll begin doing that early next year. Are you excited about that? Yes? Me too. All right, in fact, I'll tell you what we'll do. Where's Paulo? Paulo, I'll make a commitment. I get myself into so much trouble. The next time I come back, we'll at least do an Aroma Touch demo. If we're not ready to do a full training yet at that time, we'll at least do a demo so that we can start the process moving. Will that be okay? Okay, good. I just got myself, I'm not coming next time now, I'll have to send somebody else. I get myself into trouble all the time. One last thing to talk with you about. Do you feel like you've been fire hosed today? You've gotten a lot of information. I told you you would. I told you there was a lot of information, and you're going to need to separate out what's important to you. Now going forward, we're going to break this into smaller segments where we may spend as much time, but it'll be very detailed in smaller segments, and so that'll make a lot of sense to you and help you take another step. I want to leave you at the end of the day today talking about pharmacokinetics. I want to talk about the safety of the essential oils and give you some guidelines to institute and practice all of the things now that we've talked about today. When we look at that in physiology, that's referred to as pharmacokinetics. When we look at it in the context of essential oils, there's a real clear statement that begins to make sense. The value of essential oils, and consequently the vulnerability of the essential oils, is always an issue of concentration and delivery. In other words, how much we use and how we use it determines both the benefit and the risk associated with essential oils. So let me describe to you what that means. I'm going to introduce a couple more terms to you. One is metabolic capacity, and then the other one is effective range. Our goal is that we never supersede metabolic capacity. Metabolic capacity is our body's own unique ability to metabolize what we give to it. My capacity may be greater than yours, and sometimes it may be less than yours. It's a moving target. It is never stationary. One of the greatest impacts there is with metabolic capacity is our health. Are we feeling well, or are we feeling diminished in some way? And then effective range is, it's interesting, as we start using essential oils, one of the things that we learn is that the amount of oil that I use and the benefits that I receive are equally correlated. They're proportional one with another. But when I reach metabolic capacity, when I supersede my body's ability, there is such a thing as too much of a good thing. And when I supersede that, then I get into an area of risk. And another thing begins to happen. Let me define what I mean by risk. Risk can mean sometimes you see an unwanted outcome. Maybe somebody has a skin reaction or a skin response. I hear people using the terminology, oh, that just means that you're cleansing. That's really a good thing. You should do more. That's not what that means. That means you've reached the threshold of your body's capacity and you're exceeding that. And so you've got to learn. Remember early on in the day today, I said your greatest strength will be you individualizing your usage of the essential oils and knowing how your body reacts and responds to that appropriately. And this is one of the primary reasons why. Another interesting thing happens is that as we reach that maximum capacity, we always think that the more the better, but in reality, as we cross that threshold, it becomes inversely proportional. The more you use, the less benefit you receive, because we are challenging the body's ability to utilize it fully. That makes some sense if you start to think about it. Now let's talk about how we typically use the essential oils. On the bottom line there, we have optimal wellness, and as we go further to the right-hand side, I'm becoming more well. So closest to the left, I'm not feeling very well. One of the interesting things that happens is when I'm not feeling well, my metabolic capacity is greatly diminished. What my body can handle is diminished. I can't do as much. Let me give you an example in medicine. When someone has cancer, the types of therapies that are done for them are greatly diminished. I'll do radiation for you. I'll do chemotherapy for you. I'm sorry you're nauseated. I'm sorry you're hurting. I'm giving you nothing for that. Because there's a limitation in what your body can actually handle, metabolic capacity. And when we become compromised for any reason, whether it's poor nutrition or toxicity, or I'm under chronic stress, or I have some type of an illness that's challenging me right now, what I can give to my body and what it can actually handle is less. And we all make the same mistake. I made this mistake when I started using the oils. The more I use, the better it is. And we overwhelm ourselves very quickly. And I can't tell you how many people come to me and they're surprised when I say, and as I talk to them, they say, gosh, I don't understand. I'm struggling with this and I'm not doing well. And I heard Dr. Stoyer speak and he said this. And I heard Dave Sterling and he talked about he did this with his kids. And Justin came and taught a great class. And Ryan taught a great class. And I heard Emily Wright and she cried and everything. And so I started using those oils. And then Dr. Hill came and I started using these oils. I talked to a person not too long ago and I said, tell me what oils you're using. She listed out more than 30 oils that she was using to try to combat this illness, completely overwhelming herself. Remember, risk isn't necessarily that I'm having some type of a bad response. It's that the benefit I'm receiving is beginning to diminish because I'm just overwhelming the body. On the other hand, when we're feeling really well, like we see on the far right-hand side, this is the time where we think to ourselves, I'm great, I'm good, I don't need anything. And so we use much less of the oil. That's the time we should be in our daily routines. That's the time we should be creating resiliency for ourselves. And so I want you to change your thinking and do just the opposite of what you typically have done. When you're feeling poorly, when you're not feeling good, that's the time for reduction of use and very focused use. Notice I didn't say stop using them. I want you to become very focused. If you're having a respiratory issue, deal with the respiratory issue. It's always easier to add more than it is to take some away. Once I'm overwhelmed, I have to metabolize that, and I'm overwhelmed. On the other hand, when I'm feeling well, that's the time to get into these daily routines. So begin a practice of learning where your personal threshold is. It's not, some people have asked me, how do I know where mine is? Because of how you're responding. I'll give you a good example. One of my first experiences with peppermint was with my then young son. He used to get horrible migraines. It was terrible. And I came home one day from a trip. He had a migraine and he had a very high fever. And I have a good friend who's a pediatrician who my wife had called. My wife is the best at saying, do you think we should call a doctor? I'm listening, and yes, you can call me. And I was working with my son, and in comes my friend, the pediatrician, who was very angry at me and telling me I was not treating my child fairly, that he should just go to the hospital and be treated. And I was convinced that was not necessary for my son, and so I gave him some peppermint, and it had no effect. A few minutes later, I gave him a little bit more, and it had no effect. And a few minutes later, I gave him a little bit more, and his fever began to reduce. A little bit later, I gave him a little bit more, and his fever broke, and he was fine. Incrementally finding out where our threshold is really valuable to us. And yours is going to be different than mine. I'm an old battle axe. I feel like I can do almost anything, and I'll be okay. When I started taking essential oils, I'd take 20, 30 drops at a time, and I'd take multiple capsules at a time. And I didn't really feel the benefits, and now I know why I wasn't feeling the benefits. Because although I wasn't in an area of danger in my body, I was having this inverse response. So become very focused. Focused response is what we want to do when I'm dealing with specific challenges. Here's a good rule of thumb. Less oil more often is always better than large amounts of oil in a singular sense. Does that make some sense to you? So you can still use the oils, but we're going to do it incrementally, and I'm going to find what works the very best for me. Now, there's different ways that we can use the essential oils, of course. We can use it aromatically, we can use it topically or dermally, we can use it internally, or we can use it orally. Now, there is a difference between internal and oral. Oral is really what we do when we just put an oil under the tongue. That's oral use. Internal use is what we do when we put it in a capsule. The difference of effect on that is it absorbing within the gastrointestinal system or becoming more systemic. In a very real sense, if somebody was having a heart problem, Dr. Stoyer might run to them and stick some nitroglycerin underneath their tongue because I get quick systemic response. I bypass things and I go systemic immediately. That's why I like using frankincense under the tongue. That doesn't mean that aromatically and topically are less valuable. It's not what it means. It means they all have their own benefit. All of them become systemic at some point. I like using the oils aromatically, however, because its primary benefit is about affecting the respiratory system and also affecting the cognitive system, the brain, emotions. That's why I like using oils aromatically. It doesn't mean that they can't, I've got other challenges and I've got other issues. It doesn't mean it won't be helpful. Use the oils in the way that works best for you. Your oil usage is going to be directly matched with your confidence level. And so if you're not comfortable using oils topically, or if you're not comfortable using them internally, find the way that you can use them and use them to their greatest benefit and extent. I like using oils topically because, again, I get systemic benefit, but I can get targeted benefit too. If my knee hurts, topically is the only way I can really get access directly to the area that I want to target. I can put the oils directly on my knee. And then internal and oral, as we already discussed. Now, we did an interesting study. We looked at this and thought, let's look at what we know about parameters of metabolism. And we know that there is a standard metabolic rate within the body, and generally most things will metabolize between 4 to 6 hours. And then we applied some math to this too. This became a really complex equation for us, but we ended up graphing out what happens metabolically when we use oils aromatically, when we use them topically, orally, or internally. And it begins to give you some understanding about why all three of that methodology, I'm going to combine now internal and oral and just say that's one, why all three of those have benefits. And so if we look at this scale, we see on the left-hand side bioavailability. How bioavailable is it when we use it? And then on the bottom, we see time of metabolism. How long before it's metabolized? How long does it last in the system? And so if we look at this first one right here, which is, darn it, keep pushing the wrong button. If we look at the first one here, which is oral and internal, it's readily bioavailable, especially if we use it under the tongue. Very quickly, it's bioavailable in both of those scenarios. However, it metabolizes fairly quickly, so it's not very long lasting. So what you need to begin to think about is when I use it internally, fast acting, not necessarily long lasting. Does that make some sense? And if you look at the graph, you can see how it illustrates that. If we look at topical application, this is an interesting one because it's not really readily bioavailable initially. There's a summation point as it begins to become absorbed more fully into the skin, into the tissue layers. There's absorption and penetration. Absorption is how oils move into the tissue. Penetration is how they move through the tissues. And initially, there's some time involved in an oil absorbing through those tissue layers. But then we reach a summation point and it becomes more bioavailable. And then over time, it slowly becomes metabolized. So we don't have as high as bioavailability initially, but we have a growth and a longer lasting metabolism curve. Does that make sense? And then if we look at aromatic use, inhalation, this actually now is, after seeing all of this, is one of my favorite uses of the oils. Primarily because bioavailability is diminished only because diffusing the essential oils into the air is a model of dilution. So concentration becomes greatly diminished, doesn't it? But because the bioavailability and the metabolism is fairly stable and constant, it means I can diffuse all the time. Remember, at Vanderbilt University, which was the first hospital we went to, we diffused for 5 years, 7 days a week, 24 hours a day, without ever stopping, and didn't even have one single adverse event. We had nothing but positive outcomes. So diffusion is a mainstay for you. You can't overwhelm yourself with diffusing the essential oils. It's a great augment to everything you do every single day. So I look at this, and many times people don't know how to diffuse the essential oils or why I should diffuse the essential oils. So I've broken it into 3 succinct categories for you. One is rest. Anytime, now rest, I don't just mean sleep. I mean rest, stress, anxiety, and all of those oils that I have listed there, and you can have your own favorites. There's many, I just listed some of my favorites. But a lot of the floral oils work extremely well. You notice I only listed one floral oil because I prefer other types of aromas. But if you like the smell of lang-ylang, or maybe it's serenity, or maybe it's elevation, or citrus bliss, or rose, or jasmine, or geranium, or whatever it happens to be, choose one of those oils that will help you to de-stress. Here's just an example of some. Mood oils. Again, we have lots of oils that are good for mood. And why I like doing this is that our mood tends to fluctuate with some of the challenges that we have when we're under stress, right? And so some of these can be combined, but periodically diffusing oils from this list makes a lot of sense. And then lastly, immunity. A good example of that is I talked about On Guard and diffusing On Guard in the evening, or diffusing one of the respiratory oils like Breathe, or eucalyptus, or rosemary, or lime in the evening. So some good, easy categories you can think of that these are some choices I can make. Here's my reasons for diffusing essential oils. So that should be helpful to you. You can fill in those categories how you would like to. Now, internal use is a little bit different because what I like about it is we can have precise amounts. We can have exact amount. We get high bioavailability, which we already talked about. I greatly reduce my risk of any irritation, even with caustic oils like oregano and thyme and clove. And I get gastrointestinal support. We can use oils topically over the liver or over the stomach or over the intestinal tract. But when I use them internally, it's a direct route to those areas. And so to me, this makes good sense for gastrointestinal support. I have an upset stomach, think about Digest Zen, or maybe it's ginger, or maybe it's fennel, or maybe it's cardamom. I mean, you can put any number of oils that will fit into that category. So think about internal use for digestive support primarily. And then lastly, I want to talk with you about topical use. Now, in topical use, I want to give you a reminder of what I talked about, talking about the value of essential oils, and so consequently, the benefit and the safety of essential oils is an issue of concentration and delivery. I've noted that there's a lot of people that say you can't use an essential oil unless you dilute it. Frankly, I don't care if you dilute the essential oil or not. I only care that you're using the essential oil. If you're not using them, they're not giving you any benefit. One of the biggest mistakes we all make is we fail to use the essential oils. Remember, oils is not what I do. Oils is who I am. And so we've got to get into that mindset of thinking to use the essential oils. Now, what I like about it is all the things we mentioned earlier, is that it's localized. It does absorb into the tissues. It is targeted. And we can influence absorption. Remember what I said, absorption is how oils move into the tissues. Penetration is how they move through the tissues. We can influence absorption. Let me give you some reasoning about why I think that's important. How oils are applied can create a localized benefit or a diffuse systemic profile. Now let me explain to you what that means. I'm going to talk very specifically about diluting, and I want to build some reasons about why we would dilute and why we might not dilute, and then you can use your own judgment about how you want to use the essential oils, rather than just arbitrarily saying all oils have to be diluted, because that wouldn't be true. And so if we look at the structure of the skin, we're really concerned about two primary areas. One is the stratum corneum. This is the layer on the top of the skin. This is the dead tissue layer that's on the surface of your skin. And then lastly, we have just the deeper tissue layers. This is where penetration and then systemic activity begins to occur. Whether it's absorbed into the lymphatic tissue or in through the circulatory system, we can begin to have systemic distribution of some of those benefits. And so both of these play equal and important components of what we're talking about. One of the things that is interesting about the stratum corneum is that it can, forgive me. It can act as a reservoir. So as we apply an essential oil, it can actually hold that essential oil in those tissue layers for up to 4 hours. And so it's slow to move through those tissues. One of the reasons why we can put oregano on the bottom of the feet and it's non-irritating is because it's slow to move through those tissue layers. Now we do want it to absorb quickly, because remember what the oils are. They do flash off. They're aromatic compounds. They're volatile aromatic compounds, and so they diminish quickly within the air. Stratum corneum, here's a good example. Oregano on the bottom of my feet, which is what you see on your right-hand side, really thick. In some of the other areas of the body, that stratum corneum is very thin. Don't put peppermint around your eye. Don't put oregano around your eye. You're not going to like the outcome. It will be irritating because those tissue layers are very thin. So density of the tissue begins to matter. Let me break it down for you in this context, that dilution of essential oils. When we dilute an essential oil, we hold those lipophilic compounds, those aromatic compounds, are held in solution, which means they don't flash off. They're held in solution. That's one advantage. But also, it holds it in the tissues. It localizes it within the tissues. So let me give you an example. If I wanted to use cedarwood, for example, to target some of the wrinkles around my eyes, or maybe I wanted to use wintergreen or deep blue over my knee because I'm having a lot of pain and discomfort, I would dilute that essential oil. Not because it's caustic and not because it's irritating. I would dilute it because I want to localize it in those tissues. And when we dilute it, it holds it in those tissues, and the metabolism of that oil is not a systemic process. It localizes right where we put it. Enzyme activity begins to happen right here. We begin to have some of the primary benefits from that essential oil localized in the tissue. When it's non-diluted, I don't get that localized response. I get a lot of flash off of the essential oil. It does absorb into the tissues, it does penetrate, and it begins to move elsewhere. And so when I want to localize response, it's a good idea to dilute the essential oil. When I want broad perspective and broad activity, it's a good idea to not dilute the essential oil. So caustic oils, bottom of the feet. It begins to make some sense, doesn't it? So you can dilute if you want to, but there's some better physiologic reasoning as to why you would or wouldn't. Now, in doTERRA, we've been listening to you, and we're also launching for you today our doTERRA touchline. Now, these are all pre-diluted for you. These are all pre-diluted for you. Now, somebody asked me, what's the ratio of dilution? The ratio of dilution is not consistent throughout these essential oils. Remember what we do in doTERRA. We're always working for therapeutic outcome. And so every single oil has its own ratio so that we get that balance between aroma, physiology, and the chemistry that we talked about. So this is a beautiful line of essential oils. Now, here's why I like this. My wife had an incident in our home where at the time, this was 8 years ago, my granddaughter was just a newborn and she became very colicky. And my wife and daughter had attended a lecture where I talked with them about using some essential oils that would be helpful to help soothe that for a young child. And being very dutiful, they got out the oils and they thought if a little is good, more is better. And when I got home, my granddaughter was screaming and my wife was crying. She felt like she had really hurt my granddaughter, and frankly, she did. I got it calmed down very quickly. I used a lot of coconut oil. We solved the problem. I taught them how to do it. It worked wonderfully from that time forward. My wife instantly became afraid to use the essential oils on any of our kids, any of our grandkids, and she stopped trying to help other people. She only used them for herself until we came out with the touchline and her confidence began to come back. Why did we dilute these oils? Because we recognize that sometimes we do use them for smaller children and we need smaller amounts. And one of the things that happens when we dilute essential oils, remember, doesn't flash off. And so smaller concentrations can be just as effective as larger doses. And so there is a great element here that this now makes us available for your entire family. And if you like diluting the oils, here's some wonderful oils that you can use that way. Now my time is gone, so I'm just going to go through this real quickly. Now this is not the roll-ons that you have in the doTERRA touchline, but it is the same oils. I just didn't want to insert all of those pictures in there because this does the same thing. I broke it down for Breathe. Just take pictures of these because I'm going to go through these really fast. There is, and remember, you're going to get this presentation. I'll give this to you as its own presentation, this piece right here. And so I've broken down, looked at everything in this daily prevention. How do I use this oil? How do I use Breathe every day? How do I use Deep Blue every day? How do I use Digest Zen every day? How do I use lemon every day? How do I use lavender every day? How do I use Melaleuca and On Guard? How do I use each one of those every single day? I've broken that all down for you and made it very simple and very, very easy. So I'll come back another time and we'll go through each one of these for you, and you'll receive this even before I come back in a sense that will make, in an assemblage that will make that much easier for you. It's been a great pleasure to be with you today. Sense of appreciation for you and the efforts that you're putting into sharing the essential oils here. I would like to give you my firm commitment that I will be equally yoked with you. I will do my very best to help you. continue to do. May you all be greatly blessed until I see you again in the near future. Thank you for letting me be with you. Thank you.
Voltei. Pessoal, como é que foi? Vamos dar mais uma salva de palmas para o Dr. Antelo? Nós estamos terminando. Eu gostaria de fazer um aviso, dar um aviso para vocês sobre o Aroma Touch que vocês receberam. A partir de agora, terminando essa sessão, nós vamos ter uma cabine de Aroma Touch, onde alguns Diamonds e acima vão ensinar a técnica do Aroma Touch na mão. Então, o óleo que vocês têm, se vocês quiserem aprender, é uma cabine pequena, tem 3 demonstrações ali, com 10 cadeiras, então vamos ver como é que nós conseguimos fazer isso. Mas esses óleos são incríveis, maravilhosos. Nós temos notícias sobre todos os óleos que nós falamos agora.